The heart monitor flatlined at 2:14 in the morning, and the most decorated surgeon in Harlow General's 30-year history stepped back from the table, pulled off his gloves, and said, "He's gone." 12 people stood in that operating room. 12 people trained for exactly this moment, and every single one of them started to move away. Except one. A junior agency nurse, nobody special, nobody important, the woman who'd spent the last 4 months being talked over, talked around, and talked at, stepped forward, looked at the ruined chest cavity on that table, and said 3 words that stopped the room cold. "I can fix him." Before we go any further, if stories like this one hit different for you, if you're the kind of person who believes the ones they overlook are often the ones who matter most, hit that subscribe button right now and turn on notifications. Every week we bring you stories that will pull the floor out from under you, and you do not want to miss what's coming. Drop a like on this video and tell me in the comments, what city, what country are you watching from right now? I want to see exactly how far this story travels. Now let's go back to that operating room, because what happened next, nobody in Harlow General has talked about the same way twice. The shift started the way most night shifts started at Harlow General Hospital in Denton, Washington, with too many patients, not enough staff, and a charge nurse running the floor like she was trying to hold a flooding ship together with her bare hands. Maya Reeves arrived at 10 minutes to 11, signed in at the agency kiosk, clipped her badge to the left pocket of her navy scrub top, and made her way down the west corridor without stopping to talk to anyone. She knew better. In the 4 months she'd been cycling through Harlow General's surgical wards on contract, she'd learned exactly where she stood in the building's social architecture, and it wasn't anywhere near the top. She was agency, temporary, disposable in the way that anyone who could be replaced next Tuesday was disposable. The permanent staff tolerated her with a particular brand of professional politeness that felt worse, somehow, than open hostility, because at least open hostility acknowledged you existed. She collected her assignment board from the charge desk, scanned the room list, and headed for supply. "Reeves!" The voice came from behind her. She turned. Donna Park, senior floor nurse, was watching her with an expression that hovered somewhere between pity and mild contempt. "You're on surgical assist tonight. Dr. Harlan Voss is running his elective rotation from midnight. Don't get in his way." "I won't," Maya said. "He doesn't like questions from agency staff." "Understood." Donna looked at her for another second, like she was waiting for Maya to say something that would confirm whatever she already thought, then turned and walked away. Maya turned back toward supply. She was 28 years old and had been a nurse for 4 years. Before that, she'd been something else entirely, in places that didn't make it onto any official resume. But she never talked about that, and she'd gotten very good at making sure nobody thought to ask. She moved through the supply corridor with the quiet efficiency of someone who didn't need to think about what she was doing because her hands already knew. Gauze, irrigation sets, suction tips, retractor packaging. She counted, confirmed, restocked the mobile cart, and was back at the surgical wing in under 7 minutes. The wing was quiet, the way hospitals get quiet after midnight. Not empty, just pressed down, like all the noise was being absorbed into the walls. The fluorescent lights buzzed at a frequency you stopped noticing after the first hour. Somewhere 2 corridors over, a patient was calling for a nurse at irregular intervals in a voice that never quite reached panic. Maya was checking the monitor readings on a post-op in room 14 when the radio at the charge desk crackled. She didn't catch all of it. Something about a highway, multiple vehicles, critical status inbound. She heard the word cardiac, and then heard it again, and then the charge desk exploded into a different kind of movement. Donna's voice cut through the corridor. "Trauma bay now. All available surgical assist." A pause. "And somebody get Voss on the phone." Maya left room 14 and moved toward the trauma bay. His name was Garrett Hollis, and by the time the paramedics brought him through the bay doors, he was a problem that looked unsolvable. 47 years old, broad through the shoulders, wearing what was left of an expensive suit that had been cut off in the ambulance. His chest was wrong. Maya could see it from 15 feet away. The asymmetry, the way his left side moved differently than his right when the paramedics were doing compressions. His BP on arrival was 61/40. His oxygen saturation was not a number anyone in that bay was going to write down calmly. The lead paramedic was talking fast. "Head-on collision, Highway 12, semi versus passenger vehicle. Patient was driver, significant chest crush, suspected tension pneumo on arrival. We needled him in the field. Partial relief. 3 IVs, wide open. GCS, 7 on scene, now 9. He's been in and out. Who's the surgeon? Someone called. Voss is still 20 minutes out, Donna said. Dr. Linfield is on backup. Get Linfield moving. Maya moved to the left side of the gurney and helped transfer Hollis to the trauma bay table. His eyes were open, barely unfocused, rolling toward the ceiling. His lips were moving, but nothing coherent was coming out. She watched his chest for 2 full seconds. His left chest wall is still compromised, she said quietly, to no one in particular. The paramedic nearest her heard. Yeah, we thought about a second needle, but his pressure tanked when we... That's fine, Maya said. You made the right call. She stepped back to give room to the trauma nurses already setting up lines and leads. She was surgical assist, not trauma. Her job right now was to be ready for wherever this went next. So she stood, and she watched, and she cataloged everything she was seeing. The way Hollis's respiratory pattern was irregular and shallow, the paradoxical movement in his lower left rib cage, the slight cyanotic tinge at the nail beds of his left hand. Dr. Linfield arrived at a near run, white coat over street clothes, and immediately began calling out orders. He was competent. She could see that. Organized under pressure, clear with his communication. But when she watched him assess the chest X-ray that came up on the bay screen 40 seconds later, she saw his eyes move to the obvious injury and stay there. There was something else in that film that he wasn't looking at. Something in the lower field, lateral, partially obscured by the rib fracture shadow. She looked at the film for 3 more seconds, then looked away. Not her place to say. Dr. Harlan Voss arrived at 11:42, still moving like he was annoyed to be here, which was his default setting. He was chief of thoracic surgery at Harlow General, had been for 11 years, and he wore that fact like a piece of clothing, something that altered his silhouette, something you were supposed to notice. He was also brilliant, in the particular way that certain people are brilliant. Total technical mastery, almost zero peripheral awareness. He could repair a dissected aorta in conditions that would buckle most surgeons, and he absolutely could not tell you the names of any of the scrub nurses who handed him instruments. Maya had worked 3 of his cases. He had never looked directly at her once. He took over from Linfield with the ease of someone used to taking over from everyone, reviewed the imaging, ordered the OR prepped, and had Garrett Hollis rolling down the corridor toward OR 2 inside of 9 minutes. Maya followed because she'd been assigned to surgical assist, and that meant wherever this went, she went too. OR2 smelled like every other operating room, antiseptic over metal, something warmer underneath that you never quite got used to and never quite forgot. The room was prepped by the time Hollis was transferred to the table. The anesthesiologist, Dr. Frank Patel, was already at the head of the table running his prep sequence, talking in a low, steady rhythm to the monitoring tech beside him. Maya took her position on the perimeter and began organizing the instrument trays, not because anyone asked, but because they needed it, and she could see that nobody else was going to do it with the efficiency the timing was going to require. "Who's that?" Voss asked, not looking up from his hand scrub at the sink. "Agency, sir," the scrub tech said. "Does she know what she's doing?" "She's been here 4 months. That's not what I asked." "She's fine, Dr. Voss." He said nothing else. Maya kept organizing. The incision happened at 12:08. Voss moved through the chest opening with the kind of speed that came from years of absolute confidence in your own hands, and for the first 12 minutes, it looked like this was going to be a difficult but manageable repair. The rib fractures were addressed. The tension in the pneumothorax was confirmed and relieved surgically. Hollis's pressure responded. Then Voss went for the artery. Maya was handing a suction tip to the scrub tech when she saw it. The angle of approach, the position of the clamp, and the thing that was still in that X-ray that nobody had fully registered. The left intercostal artery, secondary branch, running behind the primary injury site. The paramedic's needle in the field had done exactly what it needed to do to the obvious injury. What nobody had caught was the partial tear running posterior to it, Voss was about to put tension on a repair that was going to pull directly against that tear. She did the math in about 2 seconds. She said nothing. He made the move. For 6 seconds, the repair held. Voss said something to the scrub tech in a satisfied tone that was exactly 1 sentence too early. And then the posterior tier gave way, and the field flooded with blood in a volume that changed the energy in the room instantly and completely. "Suction," Voss said sharply. "Get me suction now." Patel called out a pressure drop. The scrub tech moved. Maya was already at the tray and had the correct suction tip in hand before anyone asked for it, pressing it into the scrub tech's palm with the calm of someone who had been watching this exact moment build for the last 12 minutes. Voss worked. He was fast, he was precise, and he was also working with the wrong information, because he still hadn't identified the posterior tear, only the blowback from it, and every move he made to address what he could see was making the thing he couldn't see worse. The monitor spiked. "BP's crashing," Patel said. 52/30. He's going into hemorrhagic shock. "I see it," Voss said. Harlan. Linfield, who had stayed in the room, stepped slightly forward. "What do you need?" "I need suction, and I need quiet," Voss said. Maya watched the field. She counted. She watched the pattern of the bleed, the direction of pressure, the way the tissue was behaving under Voss's correction attempts. She could see exactly what was happening. She could see why his corrections weren't working. She could see what would work. She stood very still. "Pressure's not responding," Patel said. 48/28. Voss made another move. It didn't help. 44. There was a particular kind of silence that settled into an operating room when everyone present understood, without saying it, that the situation was moving past the edge of recoverable. Maya had been in that silence before. She'd been in it in places where there was no anesthesiologist, no instrument trays, no powered suction, just her hands and whatever she could improvise and the absolute non-negotiability of the next 60 seconds. She recognized this silence. "He's going to arrest," she said. She hadn't meant to say it out loud. It came out quiet, almost under her breath, but the room was silent enough that it carried. Voss looked up from the field. His eyes went directly to her, the first time he had looked directly at her in 4 months, and the expression on his face was not one she was going to forget easily. "Who the hell said that?" "Agency nurse," the scrub tech said, with the tone of someone who was already distancing themselves from whatever was about to happen. "Get her out," Voss said. "Now." "Dr. Voss," Linfield started. "I don't need commentary from a—" He stopped, seemed to decide that finishing the sentence wasn't worth his time. "Get her out of my operating room." Maya didn't move yet. She looked at the monitor. She looked at the field. She did the calculation one more time. "There's a posterior tear in the left intercostal branch," she said. "It was in the imaging, lower field, lateral. It opened when you put tension on the primary repair. You're not going to stop the bleed until you address that." The room went still in a different way. 41/22, Patel said. His voice was even, but there was something underneath it. Voss stared at her. "You have 30 seconds to get out of my OR before I have security remove you." Maya looked at Garrett Hollis. She looked at the monitor. She looked at the blood. She walked to the sink, turned on the water, and started scrubbing. "What in the—" Voss started. "She's scrubbing in," Linfield said quietly. He was watching her with an expression that was half alarm and half something else, something more careful. "Harlan, his pressure. We have to This is my operating room." 39, Patel said. "He's going to code." Voss turned back to the field. He made 2 more attempts. Neither of them worked. The bleed was slowing in one place and worsening in another, exactly the way it would worsen if you were addressing the wrong source. "I need a size 4 vascular suture and a second set of hands," Maya said from the scrub station. She was gloved now, gowned, moving toward the table. "And I need 30 seconds of unobstructed access to the posterior field." "You are not touching this patient," Voss said. "His pressure is 36, Patel said. There was no evenness in his voice anymore. "Harlan, 36. Linfield made the decision. He wasn't the chief. He wasn't going to win the political argument later. But he was in this room, and he had eyes, and he said, "Let her work." Voss went rigid. "You don't have the authority." "His heart is going to stop in under a minute," Linfield said. "If she's wrong, she's wrong. But let her try." The silence lasted 4 seconds. Voss stepped back from the table. Not graciously, not willingly, but he stepped back. Maya moved in. She didn't think in words when she worked. That was something she'd noticed about herself a long time ago, back when she'd first understood what it meant to operate under pressure that was real rather than simulated. The thinking that happened when her hands were in a surgical field was different from the thinking that happened in the rest of her life. It was faster, quieter, more like pattern recognition than sequential logic, more like reading a language she'd grown up speaking. She found the posterior tear in 11 seconds. It was exactly where she'd told Voss it would be. "Suction to my left," she said. The scrub tech, after a 1-second hesitation that she clocked and didn't hold against her, moved. "I need the 4-O-proline." It appeared in her palm. She noted, somewhere in the back of her mind, that the scrub tech had the correct needle loaded without being told. Good tech. Someone who paid attention. The repair technique she used was not standard. It was a modified version of something she'd learned in a context that nobody in this room had any frame of reference for, a field adaptation developed for penetrating chest trauma when proper equipment was limited and time was not. She'd used a version of it twice before, both times in the dark, both times with her hands shaking from adrenaline and the particular cold that existed at altitude in the places she didn't talk about. Here, in a climate-controlled operating room with proper lighting and every instrument she needed, her hands did not shake. She worked for 4 minutes and 19 seconds. She knew because she was counting, not consciously, but some part of her always counted, always tracked, always maintained the running internal ledger of time, elapsed in status and contingency. At 3 minutes 40 seconds, Patel said, "BP stabilizing 47. At 4 minutes, he said, 53/31. At 4 minutes 19, when she tied the final suture and stepped back from the field, the monitor read 68/42 and was still climbing. The room was completely silent. Maya stripped her outer gloves. Her hands were steady. She was aware, in a low-level way, that her heart rate was elevated. Not from nerves, but from the particular physiological response that working under those conditions always produced, regardless of how many times you'd done it. Some things didn't desensitize. She'd been told that was actually the sign of a functioning system. She looked at the monitor. She looked at Hollis on the table, his chest rising and falling with the ventilator's rhythm. "The posterior repair will hold," she said. "He's going to need the rib fixation addressed in a second procedure once he's stabilized, but the vascular work is complete." She looked at Patel. "Watch for paradoxical embolism in the next 6 hours. His left atrial pressure was irregular when I went in." Patel nodded slowly. His eyes were doing something complicated. She removed her gown, stepped away from the table, and walked toward the OR doors. "Stop." Voss's voice. She stopped. She turned around. He was still standing where he'd stepped back to. He was looking at her with an expression she couldn't entirely read. There was anger in it, but something else too, something more careful, like a man trying to identify an animal he'd never seen before. "Who are you?" he said. "Agency nurse," she said. "Maya Reeves." "That technique," he said. "That repair." She waited. "Where did you learn that?" She held his gaze for 2 seconds. "I've had some interesting training," she said. She pushed through the OR doors and walked out into the corridor. Bob. She made it to the supply corridor before she stopped. She stood with her back against the shelving unit and breathed for a moment. Just breathed, deliberately, the way she'd been taught to regulate after high-stress operations. In through the nose, 4 counts. Hold, 4 counts. Out through the mouth, 4 counts. Her hands, she noticed, were now shaking very slightly. That was normal. That was the adrenaline clearing. She pressed them flat against the cool metal of the shelving unit and waited for it to pass. She had not wanted to do that. That wasn't entirely true. Part of her, the part that had spent the last 4 years doing everything possible to stay invisible, had not wanted to do that. The rest of her, the part that had watched a man's blood pressure drop into the territory where organs started shutting down, hadn't had much choice. She'd made a decision, she'd known exactly what it cost. She was still working through the inventory of that cost when she heard footsteps in the corridor. Not Voss. She'd have recognized Voss's footfalls by now. She'd developed the involuntary habit of tracking people's movement patterns in spaces she occupied regularly, a habit that was nearly impossible to unlearn. These were lighter, quicker. Linfield appeared at the end of the corridor. He stopped when he saw her. For a moment, he just looked at her. "He's holding," he said. "BP's 61 and climbing. Patel thinks he's going to make it to morning." "I know," Maya said. "The repair is solid." Linfield walked closer. He stopped about 6 feet away. He was in his mid-50s, gray at the temples, with the kind of face that had spent a long time watching difficult things and hadn't entirely decided what to do with that. He looked at her like someone who had just recalculated something significant. "That wasn't nursing technique," he said. "I've had additional training," she said. "Maya." He said her name carefully, like he was testing the weight of it. "What you did in there, the approach angle, the modified Prolene technique, the posterior field access without full retraction." He stopped. "I've seen something like that once before, in a paper, a surgical case study written up for a military trauma journal." She said nothing. "The author had a different name," he said, "but the technique was documented." The corridor was very quiet. "It was a good paper," Maya said finally. Linfield looked at her for a long moment. "Is there anything I should know?" he said. Not aggressively, not even with much urgency, more like a man who was genuinely trying to figure out what he was responsible for. "Mr. Hollis needs paradoxical embolism monitoring," she said, "and someone needs to review that OR footage and note that the primary repair attempt was creating bleed-back pressure on a secondary tear that wasn't in the initial surgical plan." For the record, Linfield blinked, caught the implication, filed it. "I'll note it," he said. "Good," she said. She pushed off the shelving unit, straightened her scrub top, and walked back toward the surgical floor. She did not let herself think about the military trauma journal. She did not let herself think about the name that used to be in the author field. She did not let herself think about what Voss was probably doing right now, because she already knew he was either making calls or pulling records, and either way, the clock on her invisible life had just started running. Garrett Hollis was moved to the surgical ICU at 2:17 in the morning. His pressure had climbed to 89/54 by the time they transferred him, which was not good, but it was categorically different from dead, and in Maya's operational calculus, that difference was the only one that mattered. She stood at the ICU window for 30 seconds after the transfer was complete, watching through the glass as the night staff settled him in and attached the monitoring leads. He was unconscious, sedated, breathing on the ventilator. He looked smaller than he had in OR2. Stripped of his expensive suit, stripped of the adrenaline-charged context, he was just a man in his late 40s who had gotten into a car and driven towards something he didn't know was coming for him. She'd thought that about patients before. She'd thought it about other people in other contexts, the way ordinary moments became the edge of something. She turned away from the window and went back to her floor duties. The rest of the shift passed with the kind of surface normality that she'd learned to maintain through deliberate effort. She completed her rounds. She documented. She answered a call light in room 9 and helped a post-op patient reposition. She drank half a cup of terrible coffee at 3:40 and threw the rest away. At 5:10 a.m., Donna Park appeared at the nursing station where Maya was completing documentation. Donna didn't say anything immediately. She stood next to the station and looked at her tablet, and Maya could feel the careful quality of that not speaking, the way it had weight and direction. "I heard what happened in OR2, Donna said finally. Maya kept her eyes on her documentation. "Hollis is stable." "I heard that too." A pause. "Voss put in a complaint," Donna said. "Unauthorized interference with a surgical procedure. He's asking for your agency contract to be reviewed." Maya stopped typing. Not dramatically. She just stopped, calmly, and looked at the screen for a moment. "Okay," she said. "That's your response? Okay? What response would you prefer?" Donna looked at her for a moment. The patient is alive, she said. I'm just telling you what's in motion. I appreciate that, Maya said. She meant it. Donna wasn't a warm person, and she'd never gone out of her way to make Maya feel like she belonged here, but she was telling her what was coming, and that was something. Get your documentation tight, Donna said quietly. Everything. Timestamps. Whatever you observed before you acted. She walked away before Maya could respond. Maya turned back to her screen. She opened a new documentation entry. She began to type. Outside the window at the end of the corridor, the sky was doing the gray-purple thing that happened in the 40 minutes before dawn. Not yet light, but no longer fully dark. The shift was ending. The day staff would arrive in an hour and 40 minutes. Garrett Hollis's monitor in the ICU, if she pulled it up on her screen right now, would show a pressure in the low 90s and a rhythm that was irregular but present. He was alive. The complaint was filed. And somewhere in the building, Harlan Voss was either sleeping in an on-call room or sitting in front of a computer, and she already knew which one was more likely. She finished the documentation entry. She checked the timestamps. She pulled up the pre-operative imaging from the trauma bay, the same film she'd looked at in the bay, the same lower field lateral shadow, and added a formal notation linking the imaging finding to the intraoperative development. She was thorough. She had always been thorough. She was also, she realized as she closed the entry and sat back in her chair, more tired than she'd been in a long time. Not the physical tired, but that was manageable. She'd learned to operate on much less sleep than civilians thought was survivable. It was the other kind of tired. The tired that came from spending years keeping the lid on something and then watching it come loose in a fluorescent-lit operating room at 2 a.m. She had 4 missed calls on her personal phone when she checked it at shift change. 3 were from a number she didn't recognize. 1 was from a number she recognized immediately and had not seen on her screen in almost 3 years. She stared at that last one for a long moment. She put her phone back in her pocket. She signed out at the agency kiosk. She got her jacket from the staff locker room. She walked out through the main entrance of Harlow General into the pale, cold morning of Denton, Washington, where the sky was gray and the parking lot was wet with last night's rain, and a man named Garrett Hollis was breathing in the ICU because she had made a choice. She sat in her car and didn't start it. She looked at her phone. The unknown number had sent a text while she was walking to her car. She opened it. 6 words. "We know who you are, Reeves." She read it twice. Her pulse didn't spike. That response had been trained out of her a long time ago. What she felt instead was something colder and more deliberate. The recognition of a situation that had just changed shape completely. She put the phone face down on the passenger seat. She looked at the entrance to Harlow General, at the automatic doors, the ambulance bay, the lit windows of the floor she'd just come off of. She started the car, but she didn't pull out of the parking lot, because 3 minutes later, her phone lit up again. Not a text this time, a call, and the number on the screen was the same one she'd recognized, the one she hadn't seen in 3 years. And this time, after 6 rings, she answered it. The voice on the other end said 1 sentence, and Maya Reeves, who had spent 4 years being the nurse nobody noticed, closed her eyes for exactly 2 seconds. Then she turned off the engine, got out of the car, and walked back toward the hospital entrance. Whatever she'd been running from had just caught up with her. The voice on the phone belonged to a man named Orrin Taft, and the sentence he said was, "Garrett Hollis is not who you think he is, and the people who put him in that crash are already inside your hospital." Maya stood at the edge of the parking lot with the phone pressed to her ear and the cold morning air moving through her jacket like it wasn't there. "How long have you had eyes on this?" she said. "Long enough?" A pause. "Long enough that we knew you were going to do something stupid in that OR tonight." "I saved his life." "I know you did. That's the problem." She looked at the hospital entrance. The automatic doors slid open for a man in scrubs who was either starting a shift or ending one. She couldn't tell at this distance. Couldn't tell if he was moving with the energy of arrival or the flatness of departure. She cataloged him anyway. "Habit. Taft," she said. "What does Hollis have?" "Not on this line." "Then why are you calling me on this line?" Another pause. Longer this time. "Because you need to know that what you walked into tonight is not over, and the complaint Voss filed is the least of what's coming at you." He took a breath she could hear. Go back inside. Stay close to the patient. Don't let anyone move him without documenting exactly who ordered it and when. That's going to be difficult given that Voss just had my contract flagged for review. Then be diplomatic about it. Oren. Maya. She almost laughed. Almost. The familiarity of it. The way he said her name with that particular flat patience, like he'd been saying it into phones in difficult circumstances for years, which he had, landed somewhere she didn't expect. Is he going to live? Taft asked. If nobody interferes with his recovery, yes. Then make sure nobody interferes. The line went dead. She stood for 3 more seconds, watching the entrance. Then she pocketed her phone and walked back through the automatic doors. The day shift change at Harlow General happened in stages rather than all at once. A rolling handoff that stretched from 6 to 6:45, as staff arrived in staggered waves and charge nurses ran floor reports that nobody ever found quite long enough or quite short enough. Maya moved through it like a current moving through still water, present without being conspicuous, signed back in at the agency kiosk on the pretense of needing to complete a documentation entry she'd flagged as incomplete. Donna Park was at the charge desk when she came back through. Donna looked at her, said nothing, looked back at her tablet. Maya took that as permission and went to the ICU. Hollis was where she'd left him, which was the most she could have hoped for. His pressure had climbed to 94/61, which was genuinely better than she'd expected given the volume loss in OR2. His rhythm was still irregular. There was a premature ventricular contraction pattern she didn't love, and she noted it in her observation log. But he was maintaining without additional intervention, and the ventilator was doing its job. She stood at his bedside for longer than a brief nursing check required. He was a big man. Broad hands, the kind that came from physical work early in life, even if the expensive suit suggested he'd moved far enough from that point that the hands were incongruent now. Mid-40s, maybe closer to 50. The lines on his face weren't the soft kind. His left forearm, exposed below the hospital gown sleeve, had a scar that ran parallel to the ulna. Surgical, deliberate, not from the crash. Old. Years old. She didn't touch it. She didn't need to. She looked at his face. He was nowhere near consciousness, but even sedated, even with a ventilator tube and monitoring leads and the waxy pallor of someone who'd lost more blood than most people survived losing, there was something in the set of his jaw that registered as the residue of someone who'd spent a long time being careful. Careful people had specific enemies. She checked his IV lines, confirmed his drip rates, noted the time, and stepped back out. The ICU corridor was empty except for a transport aide at the far end moving a supply cart. She pulled out her phone and opened the text from the unknown number again. "We know who you are, Reeves." 6 words. No punctuation except the period, which was deliberate. Punctuation at the end of a threat was a particular kind of signal, the kind that said the sender was methodical. She thought about the timing. It had arrived while she was still inside the building, which meant either they had someone watching the entrance or they had someone inside. Taft had said people who put him in that crash are already inside your hospital. She pocketed the phone. She needed to think, and the supply corridor was the quietest place on this floor at 6 in the morning, so she went there and stood among the shelving units and ran through what she actually knew. Garrett Hollis. 4750. She'd confirmed from the chart. Arrived via trauma after a head-on collision on Highway 12 outside Denton. The collision itself was described by paramedics as a semi-versus passenger vehicle, which was the kind of accident that killed people cleanly and immediately, and Hollis had survived it badly damaged but alive, which meant either he was very lucky or the crash had not been executed cleanly. Crashes that were meant to look accidental and kill a specific person in a specific car needed a particular kind of setup, and if the setup was imperfect, you got this: critical injury, hospital, a window where the target was still alive and accessible. Oren Taft had worked federal protective operations for the better part of 2 decades. He didn't call people at dawn about car accidents. She needed the chart. Getting legitimate access to Hollis's chart was simple enough. She was still on the surgical assist rotation. He was her patient from last night's case, and post-op observation documentation was a normal nursing function. She pulled it at the ICU station under her own login credentials, which was important. Anything she accessed openly, with her name attached, because the alternative, accessing it covertly, was the kind of thing that could be characterized as suspicious later. And she was already aware that someone was going to be scrutinizing everything she'd done in the last 6 hours. The chart had the expected information: name, date of birth, listed occupation, financial consultant, which meant almost nothing, emergency contact, which was a woman named Petra Hollis at a Portland address, listed relationship, sister. No next of kin beyond that. She read the admitting notes from the trauma bay. She read Linfield's surgical notes, which were thorough and had clearly been updated within the last hour. He'd been in early or hadn't left. She read the ICU nursing assessment from the night team. Then she got to the pre-existing record flag. It was a small notation, the kind that could be easy to miss if you weren't reading carefully. A cross-reference to a previous Harlow general admission under the same patient ID, dated 14 months ago. The previous admission was listed as a follow-up consultation only, no procedure. Attending physician, Dr. Nadia Wolf, Department Internal Medicine. Maya looked at that for a moment. Internal medicine, not surgical. A consultation, not treatment. Dr. Nadia Wolf was not a name she recognized from her 4 months on the surgical floor. She closed the chart, went back to the supply corridor, and spent 30 seconds on her phone before she found what she was looking for. Nadia Wolf, MD, formerly of Harlow General's Internal Medicine Department, had left the hospital 18 months ago. There was no news article about why. There was a brief mention in a regional medical association newsletter about her receiving an award before her departure, and nothing after that. That was interesting. She put her phone away and went back to the ICU window. Hollis was unchanged. The monitor showed a pressure of 96/62. She watched his chest rise and fall with the ventilator for a while, thinking about the scar on his arm and the careful set of his jaw and a doctor who had left Harlow General 18 months ago. She was still thinking about it when the shift supervisor, a day rotation woman named Gail Ferris, appeared at her elbow with the particular energy of someone delivering news they'd been building toward for a few minutes. "Reeves," Gail said. "Can we talk?" "Net." The office was small and had too much paperwork stacked on every horizontal surface, which Maya suspected was chronic rather than situational. Gail Ferris was in her late 40s, competent in the way that people who had survived institutional health care for a long time were competent, adaptive, pragmatic, with a tendency to look at problems from the angle of what could be documented rather than what was actually true. "I've been asked to put you on administrative hold pending review of last night's incident," Gail said, sitting across the desk from Maya and using the kind of measured tone that meant she'd rehearsed this conversation at least once. "That means you're not assigned to patient care until the review is complete." "Understood," Maya said. "What's the timeline?" "That depends on how quickly Dr. Voss's complaint is processed. Realistically," Gail paused, "a few days, possibly a week. And in the meantime, who covers the surgical assist rotation?" Gail looked slightly caught off guard by the question. "That's not really... I'm asking because Hollis is going to need consistent monitoring for paradoxical embolism risk for the next 48 hours, and whoever covers that rotation should be specifically briefed on his hemodynamic pattern." Maya kept her voice neutral. "I documented the risk in the chart. I just want to make sure it's not something that gets missed in the transition." Gail looked at her for a moment. "I'll make sure it's communicated." "Thank you." Another pause. Gail seemed to be deciding whether to say something additional, and Maya waited. "For what it's worth," Gail said, slightly quieter, "I've heard a few different accounts of what happened in OR2, from Patel, from the scrub tech, from Dr. Linfield." Maya didn't respond to that. "Voss's account and theirs don't align particularly well," Gail said. "Then the review will clarify that," Maya said. She stood. She thanked Gail again, genuinely, if briefly, and went out to collect her things from the staff locker room. She was on administrative hold. She didn't have authorization to be in patient care areas. She was effectively suspended pending review. She sat on the bench in the locker room and thought about that for a moment. The locker room smelled like industrial laundry detergent and someone's leftover lunch. The fluorescent light in the corner had been flickering for as long as she'd been here, and apparently was going to keep flickering indefinitely, the kind of minor infrastructural failure that everyone in an institution noticed and nobody fixed. She had been suspended. The word had a particular texture. She'd been removed from positions before. Different word for it then, different paperwork, same fundamental motion of an institution deciding you were a problem it didn't want to hold. The first time it happened, she'd been 23 and had filed a report about a training incident that her commanding officer had characterized as a misunderstanding. The report wasn't a misunderstanding. She'd gotten good at being removed from things. She hadn't gotten used to it. She opened her locker, took out her personal bag, closed it. She was halfway to the door when her phone vibrated. Not a call. A text from an unknown number. Different from the first one, different last 4 digits, which meant either the sender was rotating numbers or there was more than one sender. Floor 3. East stairwell. 10 minutes. She stared at it. Floor 3 East stairwell was the old pediatric wing that had been closed during a renovation phase that was now 18 months behind schedule. She knew it because she'd gotten turned around up there once, 3 weeks into her contract, looking for a supply elevator. The wing was dark and unused and accessible from the main hospital, but not on any of the active nursing routes. She thought about Taft's instruction, stay close to the patient. She thought about the second text. She left the locker room and went toward the east stairwell. Gah. The third floor smelled like construction dust and the particular staleness of air that had been closed off from circulation for too long. The renovation equipment was pushed to one side of the corridor. Plastic sheeting, lumber, a generator that wasn't running. Emergency lighting only, the kind that cast everything in a flat, directionless glow that made distances hard to read. She pushed through the stairwell door and stood at the top of the landing. A man was sitting on the 4th step down, mid-30s, lean, wearing civilian clothes that were slightly too deliberate in their casualness. The kind of outfit you'd buy specifically because it looked like nothing. He had a specific quality of stillness that she recognized. "Reeves," he said. He didn't stand up. "You're going to have to give me a name," she said. "Dalton," he said. "Special Investigations Division, Interior Security Task Force." She didn't know the exact division by name, but she knew the type and she knew the parent organization, and she filed that. "You sent both texts," she said. "The first one, yeah. The second, that was a colleague. There are 2 of you in the building. There are 4 of us in the building." He said it without particular emphasis, just information. "We've been here since 3 this morning." She leaned against the stairwell wall. "Hollis has been working with us for the past 11 months, Dalton said. "He's a material witness in an ongoing investigation into financial fraud and regulatory evasion at the executive level of a company called Valdris Group." She'd never heard of Valdris Group. She filed that too. "The crash was not an accident," Dalton said. "I gathered. The driver of the semi fled the scene. We have partial plates. What we don't have yet is confirmed identification." He looked at her steadily. "What we do have is a reason to believe that whoever ordered the crash also has an asset inside this hospital." She processed that. "An asset or an opportunity?" He tilted his head slightly. "Distinction? An asset is someone already placed here. An opportunity is someone who was positioned after Hollis arrived." Dalton looked at her for a second. "You've been briefed on Orrin Taft's operation." "Orrin Taft called me at 5 a.m. I've not been briefed on anything." "Then how did you—" "I worked with him for 3 years," she said. "I know how he categorizes risk." She paused. "Is it an asset or an opportunity?" Dalton was quiet for a moment. "We think it's an asset," he said. "Someone who was already here before Hollis arrived. Someone with legitimate access." The corridor outside the stairwell door was silent. She could hear the building's ventilation system cycling somewhere above them. "You need me to stay close to him," she said. "We need you inside patient care." "Yes." "I've just been put on administrative hold by the shift supervisor." Dalton's expression shifted. Not dramatic, just a small recalibration. "That's Voss." Voss filed the complaint. The suspension is a hospital HR process. "We can work with the hospital administration." "Don't," she said. "If you push from outside to reinstate me, whoever is watching Hollis will know you have someone on him. Right now, I'm just a nurse who made a mistake in someone's OR. That's a story with a shape they understand. She looked at him. Let me handle the review process from inside. Dalton looked at her for a long moment. He had the kind of face that didn't give away evaluation while it was happening, which was something you trained toward or were born with. She'd never been able to tell which. How long has it been since you ran an active protection detail? He said. This isn't a protection detail. It is, functionally. Functionally, she said, it's a nurse watching a patient. If you want to maintain the appearance of normal hospital operations, that's the only shape this can have. He stood up from the step. He was taller than she'd registered when he was sitting. Not significantly, but enough. Oren said you'd have a specific point of view about operational structure. What else did Oren say? A brief pause. The thing that might have been the beginning of a smile, almost. He said you were the best trauma medic he'd ever put in the field, and that you were also the most difficult person he'd ever tried to give instructions to. She pushed off the wall. Those things are related, she said. She went back to the stairwell door. She pushed it open a few inches and listened to the corridor before she went through. Old habit, the kind that had kept her alive in places where the stairwell door was also the ambush point. Then moved through into the half-lit renovation wing. She needed to get back into that hospital without it looking like a reinstatement. She needed access to the ICU without formal patient care authorization. And she needed to figure out who in Harlow General had been in place before Garrett Hollis arrived, because that person was the problem that was going to surface next, and she wanted to see it coming. She thought about the chart notation. 14 months ago. Dr. Nadia Wolf, internal medicine. She thought about the text from the first unknown number. We know who you are, Reeves. That text had arrived before Dalton reached out, which meant the first number wasn't Dalton, which meant there were at least 2 separate parties who'd become aware of her in the last 6 hours, and only one of them was on the same side as Oren Taft. She went back down the stairs to the main hospital level and stood in the first-floor corridor, thinking. The cafeteria opened at 6:30. It was now 6:44. She went to the cafeteria, bought a coffee she didn't particularly want, and sat at a table near the window that overlooked the ambulance bay and the main entrance. From this position, she could see 3 of the 4 entrances to the building, the elevator banks in the central atrium, and the main stairwell access point. She drank the coffee slowly and watched. He appeared at 7:08. Not staff. She could tell that much from the way he moved through the entrance, the way he clocked the security desk without stopping at it, the particular quality of familiarity that wasn't the same as belonging. He was wearing visitor credentials, which anyone could obtain at the front desk by producing a name and room number. He was in his early 50s, gray coat, the kind of build that had been athletic 30 years ago and had settled into something denser since. He went directly to the elevator bank and pressed the button for the 3rd floor. The 3rd floor, which was closed. She was up from her table in 4 seconds, coffee abandoned, moving toward the central atrium. She took the stairwell rather than the elevator and came out on 3 at the east end while he would have come out at the central bank. She moved to the edge of the renovation corridor and waited. 45 seconds. He appeared at the far end of the corridor and he wasn't alone. He was talking in a low voice to someone who had been waiting for him. Someone in hospital staff clothing, scrubs, a badge she couldn't read at this distance, short dark hair. They were standing close together, the way people stand when they don't want the conversation to carry. The visitor passed something to the staff member, small, flat, the right size for a data card or a folded paper. The staff member took it without looking at it and put it in a scrub pocket. Then they separated. The visitor went back toward the elevator. The staff member went back toward the active part of the hospital, the stairwell on the far west side, the one that came out near the ICU. Maya had a choice. She could follow the visitor or she could follow the staff member. She followed the staff member. She came out of the stairwell on 2 and kept enough distance to watch without being registered. The staff member, female, she could see now, mid-30s, a badge clipped at the waist that she still couldn't fully read, walked directly to the ICU with the confident, unhurried movement of someone who had every right to be there. Because she did have every right to be there. She was ICU staff. Maya watched through the ICU observation window as the woman went directly to Hollis's bedside, checked his chart on the bedside terminal, adjusted something on his IV pole with practiced, unhurried movements, and then stepped back. The adjustment took 11 seconds. Maya was already moving. She pushed through the ICU door. No authorization, no patient care clearance, the administrative hold that Gail Ferris had issued 40 minutes ago, technically meaning she wasn't supposed to be here, and crossed to Hollis's bedside in 12 steps. The staff member turned when she heard the door. Her expression went from neutral to surprised to something else in rapid succession, and Maya had time to read the badge. Kendra Lau, RN, ICU. "What did you just adjust?" Maya said. Kendra Lau blinked. "Sorry?" "The IV. What did you adjust?" His drip rate was, "Show me the order." A pause. Something moved behind the woman's eyes, just briefly, just a fraction of a second, but Maya had spent years reading people in situations where reading them correctly was the difference between operational success and catastrophic failure, and what she saw in that fraction of a second was not confusion. It was calculation. "I don't know who you are," Kendra Lau said carefully, "but you're not authorized to be in this unit. I'm going to have to ask you to—" Maya stepped around her and went to the IV pole. The primary line was unchanged. The secondary port, the one used for medication pushes, had a small glass vial attached to a secondary line that was not in the medication administration record. The vial was clear. She couldn't identify the contents by sight. The secondary line ran directly into Hollis's central line port. She clamped the secondary line with 2 fingers and looked at Kendra Lau. "Don't move," she said. Kendra Lau moved. She went for the door at a speed that said she'd already calculated her exit route before Maya came in, and Maya had a half-second decision: maintain the line or pursue. She kept one hand on the clamp and used the other to hit the ICU emergency call button on the wall panel beside the bed, which triggered an alarm at the nursing station, which meant someone was going to come through that door in under 90 seconds. She looked at the vial. She looked at Hollis's monitor. His heart rate had ticked up in the last 30 seconds, from 72 to 81, which could be normal post-surgical fluctuation or could be the early pharmacological response to whatever was in that line. She needed to know what was in that vial before she pulled it. She needed a lab. She needed someone she could trust to run it without filing paperwork that would reach the wrong desk first. She was still holding the clamp when the ICU door opened and 2 nurses appeared in response to the alarm, and then, 20 seconds behind them, Dr. Linfield appeared in the doorway in a white coat with his stethoscope still around his neck and his expression already moving from confused to alarmed as he took in the scene. He looked at Maya. He looked at the secondary line. He looked at the vial. "I need a tox panel run on this," she said, "and I need it run outside normal protocol, right now. Whatever Kendra Lau just attached to this line, he cannot receive it." Linfield stood in the doorway for a moment that lasted longer than it should have, the moment where a person is deciding which version of this situation they're going to commit to. Then he came into the room, pulled the door closed behind him, and looked at the vial with the specific attention of someone who was beginning to understand that the night was not, in fact, over. "There's a sealed analysis kit in the trauma bay supply cabinet," he said quietly. "Point of care tox panel. It'll give us a preliminary read in 12 minutes. "Get it," Maya said. He left without arguing, which told her everything she needed to know about where Linfield had landed in his own internal calculation. She held the clamp. She watched the monitor. Hollis's heart rate was now 87. Outside the ICU, somewhere in the hospital, Kendra Lau was walking fast toward an exit, and somewhere in the parking lot, the man in the gray coat was getting into a car. And 4 federal agents who had been in the building since 3 a.m. were going to need to know both of those things in the next 60 seconds. And her phone was in her left hand, and Dalton's number was the most recent incoming, and she was dialing it before Linfield was even out of sight in the corridor. It rang once. "Lau," she said when he picked up. "Kendra Lau, ICU nurse. She just attached an unordered medication to Hollis's central line. She's running, and there was a male visitor in his 50s, gray coat, visitor badge, who came in at 7:08 and met her on the closed 3rd floor first. He handed her something." Pause. "We're on it. The vial is still in situ. I have the secondary line clamped. Linfield is pulling a tox kit. Do not remove the vial yet. We need chain of custody. I know." Reeves. A different quality in his voice now. You understand that you have now formally inserted yourself into an active federal investigation. She looked at Garrett Hollis, at his chest, rising and falling, at the monitor, 89, 90, the heart rate still climbing, still responding to whatever trace amount had gone through before she clamped the line. I understood that at 2:14 this morning, she said, when I walked back to the operating table. She ended the call. Linfield reappeared in the doorway with the tox kit in a sealed pouch. He came to the bedside and opened it without a word. His hands, she noticed, were not entirely steady. His rate is climbing, she said. I see it. He was already loading the analysis components. If it's what I think it might be, what do you think it might be? He looked at her over the bedside. There was a case in Vancouver last year, witness in a financial fraud trial, hospital setting. The compound they used was a synthetic potassium analog. Looks like a standard electrolyte push on a tox screen unless you're specifically looking for the synthetic variant. She looked at the vial. Undetectable in autopsy as anything other than cardiac event, she said. In sufficient dose, yes. Linfield held her gaze, which would have looked like a natural consequence of his injuries. The monitor hit 93, still climbing. How fast does the point-of-care panel identify it? She said. 12 minutes for preliminary. He was running the test now. If I'm right, we have a window where the ICU door opened. They both turned. Harlan Voss stood in the doorway in his white coat ID badge, the full authority of Chief of Thoracic Surgery arranged around him like something he put on every morning along with his shoes. His eyes went from Maya to Linfield to the secondary IV line, to the vial, and then back to Maya, and they were cold in a specific way that had nothing to do with surprise. Voss wasn't surprised. That was the thing she clocked first, and it landed like something physical in the center of her chest. Harlan Voss walked into the ICU at 7:22 in the morning, on a day when he didn't have scheduled procedures until 9, and he was not surprised by what he found. Step away from the patient, he said. His voice was completely level. Both of you. Linfield straightened. Harlan. I said step away. He reached for the bedside terminal, fingers moving toward something on the panel. And give me that vial. Maya's hand tightened on the clamp. Give you the vial, Maya said. Not a question, not a refusal yet. Just the words, repeated back to him, buying herself 2 seconds to read the room. Voss was standing 4 feet from the bedside terminal. His hand hadn't made contact with the panel yet. It was hovering, fingers spread, the gesture of someone who'd reached for something and then become aware they were being watched doing it. That pause was information. Linfield had gone very still beside her. The 2 ICU nurses who'd responded to the alarm were still in the room, near the door, and she could feel the quality of their attention shift. The particular alertness of people who've walked into something that doesn't map onto any scenario they've rehearsed. Dr. Voss, she said, keeping her voice at a register that was calm without being deferential. I need you to step back from that terminal. You are on administrative hold, he said. You have no authorization to be in this unit, no authorization to touch this patient, and no authorization to instruct anyone on this floor. Remove your hand from that line. The secondary line has an unordered medication attached to it, she said. I'm not removing my hand until we have a tox panel result. That line was ordered. Show me the order. The room was very quiet. Show me the order, Dr. Voss. She kept her eyes on his face. Pull up the MAR, right now. Show me the physician's signature and the timestamp. His jaw moved. A very small movement. The kind that happened when someone was recalculating in real time. Linfield spoke quietly. Harlan, let her see the order. This is not your patient, Warren. I'm aware. Show her the order. 3 seconds of silence. The monitor behind Maya showed Hollis's heart rate at 96, climbing still but slower now. The trace exposure from before she'd clamped the line was working through him, and the question was how much had gone through and whether the preliminary tox panel was going to confirm what she and Linfield both suspected. Voss did not pull up the order. He lowered his hand from the terminal. I want her removed from this unit, he said, shifting register. Not to her, to the ICU nurses at the door. Security, patient care coordinator, I don't care. Get her out. One of the nurses reached for the desk phone. Maya looked at Linfield. She looked at the tox kit running on the bedside table. 8 minutes remaining on the preliminary cycle. She looked at the monitor. She looked at the door. She made the call. She pulled her phone from her pocket, still holding the IV clamp with her other hand, and called Dalton. He picked up on the first ring. "I need a federal presence in the Harlow General ICU in the next 4 minutes," she said. Voss just tried to access the patient's monitoring terminal and is refusing to show authorization for the medication on the secondary line. She paused. "And you need to run Harlan Voss, Chief of Thoracic Surgery, against your Valdris Group asset list. Right now." She ended the call. Voss stared at her. "Who is that?" he said. His voice had changed, still controlled, but with something underneath it now, something denser. "Someone who's been in this building since 3 this morning," she said. The room held its breath. Then Voss did something she hadn't anticipated. He straightened, adjusted his white coat with the small, habitual gesture of a man resettling his authority around him, and walked out of the ICU without another word. Unhurried. The door swung shut behind him. One of the ICU nurses lowered the phone. Linfield let out a breath through his nose. "That was either very good," he said quietly, "or very bad." "The tox panel," Maya said. He checked the timer. 6 minutes. She stood at the bedside and did not move for 6 minutes. She watched the monitor, she watched the door, and she ran through the architecture of what she now knew and what she was still inferring and where the gaps were. Voss had not been surprised. That was the fixed point. Everything else radiated outward from it. If Voss was connected to Valdris Group, if he was the hospital-side asset Dalton had described, then the chain ran. Valdris Group ordered the crash. Their contact in Harlow General was already in place to manage the outcome if Hollis survived the initial event, and the crash had not been clean enough to kill him on impact. So the fallback was medical. Get Hollis to the hospital, get him into a condition where an in-hospital cardiac event was plausible, and close the loop there. Except she had been in OR2 instead of walking away with everyone else. And now the loop was open and someone needed to close it differently. The monitor beeped. Hollis's rate was still at 94 but had stabilized in the last 2 minutes. Not climbing anymore. Whatever had gone through before she'd clamped the line was metabolizing without pushing him into arrhythmia territory, which meant the timing had been off. Either the dose was low because she'd clamped it early, or the formulation was designed for slower delivery and she'd caught it before threshold. Either way, he was still here. The tox panel chirped at minute 6, 40 seconds early. Linfield read the preliminary result. He turned the device so she could see it. The synthetic potassium analog. Confirmed. Not a standard electrolyte compound. Not anything in Harlow General's formulary. A synthetic variant of the kind that required specific acquisition channels and specific knowledge of what it would and wouldn't show on a standard autopsy tox panel. She photographed the result with her phone. She sent the image to Dalton. "We need chain of custody on the vial," she said. "I know." Linfield was already pulling a sealed evidence bag from the supply cart, the kind kept in trauma bays for forensic samples. He'd gone to get the tox kit and come back with that too, she realized. He'd been thinking ahead. She released the clamp carefully, detached the secondary line from Hollis's central port with gloved hands, and sealed the vial and line together inside the evidence bag. She labeled it in her own handwriting: time, date, patient ID, her name, Linfield's name, the ICU location. She handed it to Linfield. "Don't let it out of your hand until Dalton's people take it," she said. He nodded. The ICU door opened. "What?" Dalton came in with 2 other people, a woman in plain clothes with federal credentials already out, and a man in the kind of suit that came with specific jurisdiction. The ICU nurses stepped back automatically. The speed of their entry, the way they cleared the doorway and positioned relative to the room's exits, said everything about their training without saying it out loud. The woman introduced herself as Agent Solis. She took the evidence bag from Linfield with a chain of custody form that she'd apparently had ready, signed it, handed it to her colleague. Dalton looked at Maya. Voss left the building. She'd expected that. "His car?" "Tracked it. He's heading south on Route 9. He paused. We're not picking him up yet. Why not? Because we want to see where he goes, Solis said. She was scanning the room with the efficient attention of someone conducting an assessment, not having a conversation. If Voss leads us to the next link in the chain, Hollis is still in this bed, Maya said. We have 2 agents in this unit now. Solis looked at her directly for the first time. He's covered. He was covered before I walked in and found an unordered compound on his central line. A beat. Solis held her gaze without flinching, which Maya respected even while it annoyed her. Point taken, Solis said. We're adjusting. Dalton moved closer to her. We ran Voss against the Valdris Group contact list, he said quietly. He's not on it. She turned that over. Then he's not the asset. No, he's something adjacent. Dalton glanced at the door. Voss has a financial relationship with a medical technology company called Praxis Biomedical. Praxis Biomedical was acquired by Valdris Group 14 months ago. 14 months. The chart notation. The previous Harlow General admission. Nadia Wolf, Maya said. Dalton's expression shifted. How do you know that name? Hollis had a previous admission 14 months ago. Consulting physician was Nadia Wolf, internal medicine. She left the hospital 18 months ago. She looked at him. What happened to her? Dalton and Solis exchanged a look that lasted less than a second, but contained a full conversation. Wolf is the reason Hollis came to us, Dalton said. She reached out to federal investigators 2 years ago with documentation of a clinical trial Praxis Biomedical had run using falsified patient data. Hollis was the financial officer who'd signed off on the Praxis acquisition for Valdris. He came to us 11 months ago with corroborating evidence. He paused. Wolf is in protective custody in another state. She's been there for 8 months. And Voss, Maya said slowly, was Praxis Biomedical's primary clinical research partner at Harlow General, which is how Praxis got the trial approved. Which is how he's connected, not as a Valdris employee, as someone protecting his own exposure. The shape of it completed itself. Voss hadn't known about the crash in advance, but when Hollis arrived in his hospital, the building where Voss's connection to a corrupt clinical trial was sitting in a patient's chart in a form that federal investigators might now have reason to access, he'd made a choice. He'd become useful to the people who needed Hollis to not survive. That was different from being the architect. That was worse in some ways. The architects had reasons. Voss had done it to save himself. Kendra Lau, Maya said. She's your direct Valdris asset. We picked her up in the parking structure 11 minutes ago, Solis said. She's not talking, but the compound in that vial is going to talk for her. Maya looked at Hollis on the table. His monitor was stable, 91, slightly lower than a few minutes ago, trending better. The ventilator was cycling steadily. He was somewhere unreachable and unaware that 4 people had just stood around his bed, mapping the architecture of why someone wanted him dead. His sister, Maya said. Petra Hollis, listed emergency contact. Has she been notified? We're managing family notification, Solis said. Is she actually his sister? Another exchanged look. She is, Dalton said. She's also a former Valdris Group attorney who left the company 3 years ago and has been cooperating with our investigation for 2. He said it with the particular tone of someone revealing more than they'd planned to because the person they were talking to kept asking the right questions. Maya processed that without reacting visibly. The Hollis situation was a family fracture built around a company, and the family had ended up on the same side of it from different directions. That happened. She'd seen versions of it before. I need to stay in this unit, she said. Solis started to speak. Not as federal cooperation, Maya said. As a nurse. The administrative hold Voss engineered is now, given that Voss just walked out of a building under federal tracking, probably worth reviewing. I need someone to talk to the hospital administration. Solis looked at Dalton. Dalton looked at his phone, typed something, looked up. Give me 20 minutes, he said. The 20 minutes passed in the ICU family consultation room, which was small and had 2 chairs and a box of tissues on the table that looked like it had been there for years. Maya sat in one of the chairs and did nothing in particular, which was something she was good at. the practice of genuine stillness rather than the performance of it. She'd learned it in places where movement drew attention, and attention ended careers or lives, and the skill had translated surprisingly well to hospital waiting rooms. She thought about Voss driving south on Route 9. She thought about a man who had built a career on the premise that he was the most capable person in any given room, and who had apparently maintained that premise long enough that when a genuine threat arrived, his response was to make himself useful to the people creating it rather than resist them. That was a particular kind of cowardice, not the dramatic kind, not the kind that announced itself, the quiet transactional kind, the kind that told itself it was just survival. She'd known people like that. She'd worked alongside them in institutions that created the conditions for exactly that choice, and she'd never found a way to feel anything clean about it. Her phone lit up. Dalton. Administration notified. Hold is lifted effective immediately. They'll send paperwork, but you're clear now. She went back to the ICU. Ipat. The morning moved in the specific rhythm of a critical care unit, the rhythmic percussion of monitoring equipment, the low murmur of clinical communication, the kind of time that felt both endless and compressed. Maya settled into Hollis's care with the focused attention of someone who had a reason to be thorough, rather than just a process to follow. His rate stabilized at 87. His pressure climbed slowly to 99/64 by 9:15, which was genuinely encouraging. The PVC pattern she'd flagged earlier in the shift was diminishing, not worsening. The synthetic compound had not reached a hemodynamically significant dose. Linfield came by at 9:30, checked the chart, looked at the numbers. He's going to wake up, he said. When his body decides it's ready, she said. Not before. Linfield looked at her for a moment. Voss, he said. Not a question. I don't know the full picture yet, but you know more than I do. I know what I've been told, she said. Some of it I can share, some of it I can't. He accepted that. He was a man who'd spent 30 years working inside institutions, and he understood the distinction between information that was yours to give and information that belonged to a situation larger than you. The administrative hold, he said, it's been lifted. Yes. I want it noted, he said carefully, that I went on record this morning with the shift supervisor that your action in this unit was consistent with patient safety protocols. He paused. Before I knew what was in the vial. She looked at him. Why? Because what you saw when you walked in here was clinically concerning and you acted on it. The fact that it turned out to be something much larger than a medication error doesn't change that the nursing judgment was sound. He held her gaze. I've been in this building for 9 years. I know what it means when someone files a complaint to protect themselves rather than the patient. A pause. I should have said something in OR too. She didn't tell him that it was fine because it hadn't been fine. She said, You said something when it counted. He nodded once, not quite satisfied with that, but accepting it, and left. At 10:40, Garrett Hollis opened his eyes. Not fully. It was the fractional, effortful eye-opening of someone coming up through sedation against the body's preference, the kind that happened before actual consciousness and after pure absence, the contested middle ground where pain signals were beginning to register but cognitive processing wasn't fully online yet. Maya was at the bedside. She'd been at the bedside. Mr. Hollis, she said quietly, you're in Harlow General Hospital. You were in an accident. You're safe. His eyes moved. Not tracking yet, just moving, the autonomic response to sound. You're safe, she said again. She meant it as information, not comfort, and she said it the way she'd learned to say it, directly and without softening, because people coming up through sedation needed facts more than they needed reassurance. His right hand moved on the blanket. A small flexion, fingers curling slightly. She noted the time in the chart. He didn't say anything. The ventilator tube precluded that, but his eyes stopped moving randomly and settled approximately in the direction of her face. Not quite focused, close enough. You're going to be uncomfortable, she said. That's normal. Don't try to fight the tube. Let the machine do the breathing. She watched his chest, confirmed he wasn't bucking the ventilator. He wasn't. There are people who want to talk to you when you're ready. That's going to be a while yet. Right now your only job is to be here. His hand flexed again. She watched him drift back under. Not unusual. First emergence from sedation was rarely sustained. He'd come up and go back down several times before he stayed. She updated the chart. She noted the time of first responsiveness, the quality of it, the motor response. She ordered a mild sedation taper to begin titrating him toward extubation, pending the attending sign-off, which she flagged for Linfield. She was writing the flag when her phone buzzed. Dalton. A call, not a text. She stepped to the edge of the unit, out of earshot of the other staff. Voss stopped, Dalton said. Where? 41 miles south, a location we've had flagged for 6 months. A commercial property registered to a shell company with Valdris Group connections. His voice had a quality she'd clocked before. The particular flatness of someone conveying information while simultaneously managing a larger operational situation. He's been inside for 22 minutes. Is he meeting someone? We believe so. We have exterior surveillance only at this point. A pause. Reeves, we have a problem. She waited. The Valdris Group's legal team filed an emergency motion 40 minutes ago to have Hollis transferred to a private medical facility in Seattle. They're claiming next of kin authority through a corporate health directive that was apparently signed as part of his original employment contract. Hollis hasn't worked for Valdris, and the directive doesn't have an end date, Dalton said. Their attorneys are arguing it's still binding. They've got a judge considering it. He exhaled. If the transfer is granted, we lose him. Whatever facility they move him to, they control access. Can you block it? Our attorneys are working it, but the motion is in front of a judge who has made some questionable rulings in Valdris-adjacent cases before. Another pause. We need Hollis awake enough to decline the transfer in writing. His own refusal supersedes the corporate directive. She looked through the glass at Hollis in his bed. The sedation taper she'd just ordered hadn't started yet. You want me to accelerate the extubation timeline, she said. I want you to tell me if it's medically possible. She thought about his pressure, 99/64 and climbing. She thought about his respiratory pattern on the vent, which had been increasingly patient-initiated over the last 40 minutes, which was a good sign. She thought about the PVC pattern, diminishing. She thought about the synthetic compound, cleared. It was aggressive. It carried risk. Post-surgical extubation timelines existed for reasons, and Hollis had had a significant hemorrhagic event less than 12 hours ago. It's possible, she said. It's not without risk. What kind of risk? Respiratory fatigue. If he can't sustain adequate tidal volume on his own, we reintubate, and that's a setback. She paused. But his numbers are better than his timeline should predict. The posterior repair held. He's not fluid overloaded. His lung compliance is reasonable. What's your instinct? She watched Hollis through the glass. She thought about the quality of the motor response when he'd moved his hand. She thought about the direction his eyes had settled. My instinct is that he's stronger than the chart suggests, she said. But instinct isn't data. In my experience, Dalton said, the instinct of someone with your background usually is data. She turned that over. It wasn't flattery. It was a man making a resource allocation decision and being honest about his calculus. I need Linfield to authorize the taper acceleration, she said, and I need it documented as a clinical decision, not a federal request. Understood. And you need to keep that legal motion tied up for at least 2 hours. I'll do what I can. A pause. Reeves, when Hollis is awake and coherent enough to understand what I'm about to tell him, I need you to be the one in the room. He's going to be confused and in pain, and there's going to be a person in federal credentials telling him his life just changed shape again. I need a face he might recognize as safe. He doesn't know me, she said. He will, Dalton said. He's going to be told that the person who saved his life in the OR last night is the same one who caught the line this morning. A pause. People need an anchor when the water gets rough. You're his anchor whether you wanted the job or not. She didn't respond to that. She ended the call and went to find Linfield. What? Linfield authorized the sedation taper at 11:03. He did it after examining Hollis himself, reviewing the chart, checking the most recent ventilator waveforms, and spending about 90 seconds thinking in the kind of silence that meant actual thinking rather than hesitation. When he signed the order, he wrote a note in the chart that was 3 lines long and established the clinical rationale clearly and without reference to anything federal. She started the taper. The next 40 minutes were some of the more focused of her career, which was saying something. She titrated the medications with the precision that came from understanding not just the pharmacology, but the specific human in the bed. The way his respiratory pattern shifted when the sedation lightened, the way his pressure responded, the periodic checks of his upper airway muscle tone, the monitoring of his drive to breathe. This was not a standard extubation. Standard extubations happened in controlled timelines in the daylight hours with the patient surgeon present and no federal legal motion running in the background. This was a standard extubation that needed to happen faster than standard. She talked to him while she worked, which was something she didn't always do but did when she thought it would help. Quiet, factual sentences in a low register, not designed to comfort but to orient. She told him where he was, what was happening, what she was doing. She said his name at regular intervals. She watched for responsiveness. At 11:37, Hollis opened his eyes and kept them open. At 11:41, his respiratory parameters cleared the threshold for a spontaneous breathing trial. At 11:59, she removed the ventilator tube. He coughed, hard, the full-body convulsion of a person whose airway had been occupied for 10 hours, suddenly reclaiming its function. His eyes watered. His face went red. He reached for his throat with the right hand and she caught his wrist gently, not restraining, just redirecting. "You're out," she said. "It's out. Let yourself breathe." He breathed, ragged, uneven, his face still doing the complicated work of not coughing again. His voice was wrecked, barely voice at all. "My chest." "You had surgery last night," she said. "You're going to feel it. That's normal." He blinked at the ceiling. His eyes moved slowly toward her face. "Who are you?" he said, still barely voice. "Maya Reeves. I'm your nurse." He processed that. She could see him processing, the sluggish, painful work of a brain coming online under morphine and post-operative fatigue. "Where?" "Harlow General, Denton, Washington." A longer blink, then the crash. "Yes." He was quiet for a moment, breathing. The effort of it was visible, not the desperate effort of respiratory failure, but the careful effort of someone who just had a tube removed from their throat and was getting reacquainted with doing the job themselves. "There's someone who needs to speak with you," she said. "His name is Dalton. He's going to come in shortly. I need you to be awake enough to make a decision about your medical care." Hollis looked at her. His eyes were more focused now. Not all the way there, but significantly more than 30 minutes ago. "What kind of decision?" he said. "Someone is trying to have you transferred to a different facility. You have the right to refuse that transfer. If you're going to refuse it, you need to do it in writing before—" She glanced at the time. "Before a judge rules on a motion that was filed this morning." He held her gaze. His face, despite everything it had been through in the last 12 hours, did the thing she'd identified through the ICU window earlier. Settled into that careful quality, the face of a man who'd learned to process difficult information without reacting to it on the surface first. "Valdres," he said. "I'm not going to confirm that," she said. "Dalton will." "But it's Valdres." She said nothing. Hollis closed his eyes for 4 seconds. When he opened them again, they were clearer. "Get Dalton," he said. She went to the door. She signaled the agent outside. Dalton was in the unit in 90 seconds, suit jacket off, the specific human disarray of someone who'd been working since before dawn and was running on professional necessity rather than energy. He introduced himself with his credentials. He sat in the chair beside Hollis's bed. He began speaking in a low, efficient tone, not unkind but direct, the way you spoke to someone who'd spent the last year living in the shape of exactly this situation and didn't need it softened. Maya stood at the far side of the room and watched the door. She was watching it because 2 things were still unresolved. Voss was at a location 41 miles south of here, meeting with people whose names she didn't yet know, and the Valdres legal team had filed a motion that was in front of a compromised judge. And if that motion cleared before Hollis could produce a written refusal, the next vehicle through the ambulance bay could be a private medical transport. She was watching the door because in her operational experience, the moment when a situation felt like it was being managed was exactly the moment something unmanaged walked through one. At 12:17, Hollis signed the refusal form. His signature was weak, the signature of someone whose hand didn't have full strength back yet, but it was there, and Solis photographed it and had it transmitted to their legal team before the ink was dry. At 12:22, Dalton's phone buzzed. He looked at it. He looked at Maya. "The judge ruled," he said. She waited. "Motion denied." He let out a breath. "Hollis stays." She turned back to the room. Hollis was lying with his eyes open, looking at the ceiling, his breathing still deliberate and careful. The monitor showed his pressure at 102/68, heart rate 83, regular. She was updating his chart when her phone vibrated. The text was from Dalton, which was strange because he was 6 feet away. She looked at him. He was looking at his own phone with an expression she hadn't seen on him before. Not the controlled flatness of the morning, but something that had broken through that. She read the text. Voss is coming back. And he's not coming back alone. Exterior surveillance at the commercial property shows 2 additional vehicles departing with him. Unknown occupants. ETA to Harlow General, approximately 35 minutes. She read it twice. Then she looked at the ICU door, at the corridor beyond it, at the elevator banks visible through the small corridor window, the stairwell door, the secondary access point on the east side that she'd mapped on her first week and filed away in the part of her brain that mapped things like that without being asked to. 35 minutes. "Dalton," she said. He looked up. "How many agents do you have in this building right now?" 4, plus Solis. "You need more." He was already on the phone. She looked at Hollis. His eyes had moved from the ceiling to her face, and there was something in them. Not panic, not the sedation-blurred absence of before, but full awareness. The awareness of a man who had spent 11 months as a federal witness and knew exactly what the expression on someone's face looked like when a situation was about to escalate. "It's not over, is it?" he said. She looked at him for a moment. She thought about saying something reassuring and decided against it. "Not yet," she said. His jaw set. That careful quality again. The face that had learned to receive bad information without flinching. "What do you need me to do?" he said. She looked at the door. "Exactly what I tell you," she said. "Exactly when I tell you." Outside the window, at the end of the corridor, the Denton sky was the flat white of late morning, ordinary and still, the kind of sky that had no interest in what was happening beneath it. Somewhere on Route 9, 3 vehicles were moving north toward a hospital that didn't know they were coming. And in a monitoring bay 2 floors below the ICU, a system that had been quietly running for the last 4 hours. A system that nobody had thought to check because it wasn't part of the primary investigation, because it was a secondary feed from a camera in a corridor that wasn't supposed to be active during the renovation. Captured a frame that Solis would not see until it was almost too late. The frame showed the east stairwell door on the 3rd floor opening from the inside, and the person coming through it was not Dalton's agent. The frame was 6 seconds old by the time Solis pulled it up on her tablet, and in those 6 seconds the person in the image had already moved out of the camera's range and into the renovation corridor that connected the east stairwell to the service elevator bank on the 3rd floor's north side. Maya was looking at the tablet over Solis's shoulder. She'd seen the feed notification come through on the monitoring system, had crossed to Solis in 4 steps, and was now doing the same thing Solis was doing, mapping the frame against the building layout she'd built in her head over 4 months of working here. "Service elevator goes to basement and 2, she said. "Basement connects to the loading dock and the East Wing pharmacy corridor." "Pharmacy corridor," Solis said, already moving toward her radio. "Also connects to the ICU supply access on the 2nd floor." Maya looked at the door. If someone wanted a secondary entry to this unit that didn't go through the main corridor, she was already moving before she finished the sentence. Solis called something behind her. A name, a unit designation, clipped federal communication that Maya processed in the background while she went through the ICU door and turned left, away from the main corridor toward the supply access point at the far end of the unit. The supply access was a door that most of the nursing staff used for equipment transport. propped open during high traffic hours, and coded the rest of the time. It was propped open now. Someone had put a rubber doorstop under it, the small orange kind that lived on supply carts. She pulled the doorstop out and let the door close behind her as she stepped into the supply corridor. She stood still for 2 seconds and listened. Footsteps. Below her. Moving up. She went back through the door into the ICU, let it seal, and turned to the agent Dalton had posted at the unit entrance, a man named Reyes who had the specific build and the specific stillness of someone whose professional life involved a lot of standing in doorways making rapid assessments. "Service stairs, south access," she said quietly. "Someone's coming up." Reyes had his radio out before she finished. He spoke into it in the low, urgent shorthand of someone whose radio protocol had been drilled until it was faster than normal speech. She went back to Hollis. He was watching the door. He'd been watching the door since she'd told him it wasn't over, with the particular alertness of someone who'd spent enough time in high-stakes situations to understand what a changed room energy meant. "We're going to move you," she said. "Where?" "One room over. The isolation room on the east side. It has a single access point and it's not on the primary floor plan that visitors can access." He started to push himself up. She put a hand on his shoulder, not pushing him down, just making contact, the physical equivalent of weight. "I'll move the equipment," she said. "You let me push the bed. I can walk. You were intubated 40 minutes ago." "I know." His voice was steadier than it had any right to be, given everything. "I can still walk." She looked at him for a second, the jaw, the careful eyes, the scar on his arm. "Slowly," she said, "and you hold the IV pole." She disconnected the monitoring leads from the wall panel and switched him to the portable monitor, moved the drip pump to battery, confirmed his pressure on the portable, 104/70, acceptable, and helped him sit up. He did it with the concentrated effort of someone whose core muscles had been through surgery and were now being asked to cooperate on an accelerated timeline. His face went tight, then settled. She got him upright. She got him standing, IV pole in his right hand, her left hand at his elbow. They moved to the isolation room in 38 seconds, which was 38 seconds during which she was watching every doorway and monitoring the sound of the supply corridor and tracking Reyes's position at the main entrance in her peripheral vision. She got Hollis into the isolation room bed. She reattached the leads. She confirmed his pressure again. 100/68, slight drop from the exertion, acceptable. His breathing was slightly elevated, 22 per minute, and she watched it for 30 seconds until it began to come down on its own. "Good," she said, and she meant it. He leaned back against the pillow. "You've done this before," he said. "Not the nursing." "The nursing is real," she said. "I know." He looked at the ceiling. "The other thing is also real." She didn't confirm or deny. She went to the isolation room door and checked the corridor. The person from the stairwell camera was a man named Doyle Pratt, and she didn't know that name yet. She'd learn it later, in the debriefing that happened 48 hours after the events of this morning, in a conference room in a federal building in Seattle, with Dalton and Solis and 2 attorneys and a recording device. What she knew in the moment was what Reyes's radio told her through the open door. Male, 50s, apprehended in the pharmacy corridor by 2 agents responding to Solis's call, carrying a keycard that had been cloned from a Harlow General Maintenance credential and a secondary item that the radio communication described as a contained medical device, a preloaded injector, single dose, the kind of delivery mechanism that required close physical access to a patient but produced no visual signature that a standard room camera would flag as threatening. It was the fallback. The backup to Kendra Lau's backup. That was the level of preparation. Not 1 route, not 2. 3. She stood in the doorway of the isolation room and processed that for a moment and let herself feel the weight of it. Not fear, which was a response she'd learned to root around, but something more accurate. The particular gravity of understanding exactly what you had walked into and exactly how many ways it had been designed to succeed. Then she let it go, because the weight of it wasn't useful, and she had a patient to monitor. Dalton came to the isolation room at 12:51. He looked like a man who had spent his morning moving faster than he'd planned and had not found a gap in which to do anything about that. His shirt was wrong at the collar. He'd had coffee at some point. She could tell from the set of his alertness, which was chemical rather than natural, but not food, she suspected. Pratt is in custody, he said. Injector is in evidence. He's lawyered up, but the credential cloning alone is a federal offense, and the injector contents are going to match the compound in Lau's vial. He paused. We also ran the maintenance keycard. It was registered to a Harlow general maintenance employee named Roy Ferber, who went on medical leave 8 weeks ago. Is Ferber connected to Valdres? His wife was a clinical trial participant in the Praxis biomedical trial, Dalton said. The falsified trial. She had an adverse event. She's been in a long-term care facility for 14 months. He let that sit for a moment. Ferber wasn't working for Valdres. We think he was approached under false pretenses, told he was helping an insurance investigation. He didn't know what the credential was going to be used for. Is he in danger? We have someone with him. A pause. He's going to have a very difficult few weeks. She thought about that. A man whose wife had been harmed by a fraudulent clinical trial, who had been manipulated into providing access to the person whose testimony could expose that trial without understanding what he was facilitating. The architecture of it was sophisticated in the particular way that sophisticated things were often also vicious. What about Voss? She said. 20 minutes out, Dalton said. We're letting him come. She looked at him. You're letting him walk into the building. We want him inside. His voice was flat with the specific flatness of a decision that had been made at a level above him and handed down. His communication with the Valdres-connected location this morning was partially captured, enough to establish contact, not enough for the charge we want. If he comes back here and attempts to access Hollis or interfere with evidence, you get the action, not just the communication. Yes. She understood the logic. She didn't love it. He's going to come back to this unit. Which is why I need you visible, Dalton said. At the nursing station, not in here. He glanced at Hollis. He can't know we've moved the patient yet. Hollis, who had been listening, said, Use me. They both looked at him. He's going to come here looking for me, Hollis said. His voice was getting stronger, still wrecked from the tube, still thin, but with more structure than an hour ago. Put me back in the original bed. Let him come. No, Maya said. Reeves, Dalton started. His pressure is 100/68, and he was extubated 40 minutes ago, she said. Whatever you're about to propose, the answer from a medical standpoint is no. Dalton looked at Hollis. Hollis looked at Maya. Something moved between them. The particular negotiation of two people who both understood the operational calculus and only one of whom had the authority to veto it. What if I'm not in the bed? Hollis said. What if I'm standing? You are not standing in a hospital corridor as bait for... Not a corridor, he said. The doorway. Inside of your monitoring. With that agent. He indicated, approximately, the direction of where Reyes had been. Within 10 feet. He held her gaze. I've spent 11 months as bait for this investigation. I understand the operational risk better than most people in this building. She looked at him. She thought about what Taft had said on the phone. She thought about 11 months of federal witness protection and a corporate health directive designed to disappear him into a private facility. She thought about the scar on his arm, and the careful eyes, and a man who had driven to work 11 months ago and decided not to look away from something he could have kept looking away from. You stay in the isolation room doorway, she said. Portable monitor on. Reyes within arm's reach. The moment your pressure drops below 90 systolic or your rate goes above 110, you go back in the bed and you stay there. Those are the conditions. He held her gaze for a moment. Agreed, he said. Voss arrived at 1:14. He came through the main entrance with a visitor badge, not his staff credentials, which meant he'd known on some level that his access might have been flagged, or he'd wanted the paper trail to show a different status. He was alone, which was either genuine or performance. He signed in under his own name, which was either confidence or miscalculation. Maya was at the nursing station when he came off the elevator on the second floor. She was updating a chart, which was a real task she was genuinely doing because the unit still had other patients, and those patients still needed care regardless of what was happening in the operational layer underneath the day. She heard his footsteps before she saw him. She had learned them. He appeared at the edge of the nursing station. She didn't look up immediately. "Reeves," he said. She looked up. She kept her face neutral. Not cold, not warm, the specific neutrality of a professional encounter. "Dr. Voss," she said. He looked different from this morning. The white coat authority was intact, but something underneath it had shifted. She could see it in the way he was holding his shoulders, the slight excess of control in his expression, the overcompensation of a man trying to look like someone who has done nothing wrong. "I understand my complaint has been reviewed," he said. "That's my understanding as well. I want to check on Mr. Hollis." His eyes moved toward the main ICU corridor. As the surgeon of record for his procedure, she set down her pen. "He's been moved to the isolation room." "Why?" "Infection precaution protocol," she said. "His post-op inflammatory markers were elevated this morning. Standard procedure." He held her gaze. "I'll need access." "Of course," she said. "I'll walk you over." She stood. She came around the nursing station and walked toward the isolation room with Voss behind her, and she was acutely aware of the positioning, him behind her, his footsteps, the distance, the doorways. She was also aware of Reyes, who was in the corridor ahead, positioned near the supply closet with the specific quality of someone who was doing nothing in a very alert way. She was aware of Hollis, in the isolation room doorway where she'd left him, upright, IV pole at his side, portable monitor clipped to the pole, wearing the expression of a man who'd had 11 months to think about what he'd say if this moment arrived. Voss stopped walking when he saw Hollis standing. It was a small stop, a fractional hesitation, the kind that you wouldn't notice if you weren't watching for it. Maya noticed it. "Dr. Voss," Hollis said. His voice was wrecked but clear. "I know who you are." Voss looked at him. He looked at the room. He looked at Reyes, who had turned and was no longer performing the nothing-in-particular stance. "Mr. Hollis," Voss said carefully, "you should be resting." "Probably," Hollis said. "I've been awake for about 90 minutes, and I already know about the Praxis biomedical trial. I know about the falsified patient data. I know about your research partnership, and I know about this morning." He looked at Voss with the direct level quality of someone who had nothing left to manage. "I'm going to ask you one question, and I'd like an honest answer." Voss said nothing. He was very still. "Did you know what was in the secondary line of some?" Hollis said. "When you came into the ICU this morning, did you know what Lau had put in my IV?" The corridor was silent. "I think," Voss said slowly, "that I should call my attorney." "That's fine," Dalton said. He'd come from the supply corridor doorway, which he'd been behind for the last 4 minutes. Solis was with him, and a third agent Maya hadn't been formally introduced to, and all three of them had the energy of people who had been waiting for exactly this moment and were going to be very precise about how they handled it. Dalton produced his credentials and held them for Voss to see. "Dr. Harlan Voss, I'm Special Agent Dalton with the Interior Security Task Force. I'd like you to come with me." Voss looked at the credentials. He looked at the agents. He looked at Maya. The thing on his face in that moment was not what she'd expected. She'd expected the controlled surface to hold. The professional authority, the practiced composure of a man who'd spent 20 years in rooms where he was the most important person present. What she saw instead was something much more human and much harder to watch. It was the face of a man who had made a choice in a moment of fear and spent the subsequent hours walking toward the consequences of it, and who had arrived, finally, at the place where they caught up with him. He went with the agents. He didn't resist, didn't argue, didn't make a scene. He walked with them toward the elevator with the quiet of someone who understood that the scene was already over. Maya watched him go. She looked at Hollis, who was watching the elevator doors close, his jaw set, his free hand gripping the IV pole with more force than necessary. "You need to sit down," she said. He didn't argue. He went back to the bed. The next 2 hours were the specific kind of complicated that came after an acute situation resolved and the institutional machinery caught up with what had happened. Dalton's team was in the building. Hospital administration was in 2 separate conference rooms, one with federal agents and one with their own legal counsel. The nursing staff on the second floor were operating under a briefed but limited version of events. Enough to understand that their unit had been a site of an active federal investigation, not enough to speak to it in any detail. Maya kept working. There were 3 other patients on her assignment list who had spent the morning receiving care from someone operating on about 4% of her available attention, and she went back to them methodically. An elderly post-op in room 7 with drainage that needed assessment, a younger patient in room 11 whose pain management was due for review. She did the work, documented it, communicated with the day team in the normal rhythms of a nursing shift, and let the professional routine do what professional routines did, which was hold a shape around everything else. At 2:30, Dalton came to find her at the nursing station. Voss gave a partial statement, he said. He's negotiating, but the preliminary is enough. He sat on the edge of the empty chair near the station, which she didn't think she'd seen him do before. Sit without the operational readiness in his posture. He was tired. It was visible now in a way it hadn't been at 7 in the morning. He knew Lau was going to be in the unit. He didn't know the specific compound. That's what he's claiming. He says he thought she was going to adjust his sedation to keep him under longer, delay his recovery. And the terminal? She said, when he reached for it this morning. He was trying to access the medication administration record, to delete Lau's access log before we could pull it. Dalton rubbed the side of his face. If you hadn't walked in when you did, I know. A pause. The Praxis biomedical trial documentation that Wolf provided is being re-entered into evidence now, along with the financial records Hollis brought us. The Valdris Group's legal team filed 3 more motions this afternoon, all denied. He looked at his hands, then back at her. Pratt is talking. He was a Valdris Group security consultant. He's been in 3 other cities in the last 2 years. The Vancouver case I mentioned, the witness, he was involved. Yes. She thought about Doyle Pratt, who she'd seen for 6 seconds in a camera frame and never actually encountered in person, and who had apparently spent the last 2 years moving between cities in service of making evidence disappear and witnesses unavailable. She didn't let herself think too long about the Vancouver case. And Hollis? She said. Dalton looked almost like he smiled. Not quite. He's asking for coffee. He can have clear fluids, she said, not coffee. I told him you'd say that. Tell him tomorrow. Dalton stood. The readiness came back into his posture. Not forced, just the way he was built. Orrin Taft is going to want to speak with you. I know. He's going to want more than a phone call. I know that too. He looked at her steadily. How long have you been out? 4 years. He nodded slowly. Not pushing, not recruiting, at least not with words. For what it's worth, he said, what you did this morning was exceptional. I did my job, she said. You did 2 jobs, he said, simultaneously, and you did both of them correctly. She didn't respond to that. She picked up her documentation tablet and went back to room 7. At 3:45, she was in the charting alcove at the end of the hall when the shift supervisor, not Gail Ferris this time, but the afternoon charge, a woman named Tony Albright, who had the specific energy of someone who'd been briefed about a difficult morning and was managing her reaction to it carefully, appeared at the alcove entrance. Dr. Linfield is asking for you, Tony said. Conference room B. She finished the sentence she was documenting and went. Conference room B was one of the small administrative rooms near the surgical department, the kind used for staff meetings and performance reviews and conversations that needed a door. Linfield was there, and so was a man she hadn't met. 60s, in a suit rather than clinical clothing, with the particular authority of someone who ran things rather than operated in them. Maya Reeves, Linfield said when she came in. This is Dr. William Hast, Chief Medical Officer of Harlow General. Hayes stood. He was the kind of man who stood when someone entered a room, which was either good manners or calculated signaling, and she didn't waste time deciding which. Please sit, he said. She sat. Dr. Linfield has given me a detailed account of the last 16 hours, Hast said. He had a specific way of speaking, measured, precise, the diction of someone who had testified in front of boards and committees enough times that careful speech had become his default. I've also been briefed by the federal investigation team. He folded his hands on the table. I want to understand from you directly what happened in OR2 last night. She told him. Not every detail. She was aware of what was hers to share and what belonged to the federal operation, but the clinical sequence, what she'd seen in the preoperative imaging, what she'd observed during Voss's repair attempt, the decision she'd made, the technique she'd used, the result. Hess listened without interrupting. When she finished, he was quiet for a moment. The complaint filed by Dr. Voss, he said, is being withdrawn. By the hospital, not by Voss. Given the circumstances, we're not waiting for him to act. He paused. I also want to be direct with you about something. She waited. Dr. Voss's position at this institution is under review pending the outcome of the federal investigation. That review is going to take time, and the surgical department is going to have a significant leadership gap during that period. He held her gaze. I'm not in a position to make you any offers today. The situation is too unsettled and it wouldn't be appropriate. He paused again. But I want you to know that the work you did last night and this morning will not be invisible to this institution going forward. She looked at him. She looked at Linfield, who was looking at the table with the expression of someone who was working to keep their reaction contained. I'm agency staff, she said. You were, he said. Your contract with the agency technically expired this morning when you were placed on administrative hold. A pause. We'd like to discuss a direct hire. She let that sit for a moment. She thought about the parking lot this morning, sitting in her car with a phone face down on the passenger seat. She thought about the 4 missed calls and the text and the decision she'd made when she opened the door and walked back into the building. I need to know that the clinical environment here will be different, she said. Not just for me, for all the agency and junior staff. The dynamic in that OR last night. I understand, Haas said. Do you? She didn't say it aggressively. She said it as a genuine question. Because that dynamic existed for years. I've been here 4 months and I could see it. It doesn't change because one person faced consequences. Haas held her gaze. He had the grace not to reassure her immediately. He thought about it first, which she respected. No, he said. It doesn't change automatically. It requires deliberate structural work. He looked at her. That work is going to need people who know where the problem actually lives, not people who will tell us it's fine. A long pause. I'll think about it, she said. Hast nodded. Linfield looked up from the table. He didn't say anything, but his expression had the quality of someone crossing something off a very long internal list. She excused herself and went back to the floor. At 5:10, she checked on Hollis for what she calculated would be her last time on the shift. He was sitting up. His pressure was 108/72. His heart rate was 79, regular. He was drinking water, not coffee, water, from a cup that he was holding with both hands because one hand alone wasn't fully steady yet. He looked at her when she came in. They told me what you did in the OR, he said, last night, before I was even a consideration. That was unrelated, she said. I know. He looked at the water. I have a sister, Petra. He said the name with the particular care of someone saying something they usually don't say out loud. She's been living with this for 2 years. The trial data, the cover-up, the reason Wolf came forward. He paused. One of the trial participants who had an adverse event was a woman Petra went to school with. He looked at the window. Petra came to me because she needed the financial documentation. She couldn't get it herself. She'd already left the company and they'd flagged her access, so I went back in. Maya said nothing. Let him say it. I told myself it was just a few documents, he said, that I'd get in and out and hand it to the investigators and it would be straightforward. A quiet exhale. It was not straightforward. No, she said. He looked at her. Why did you come back into the building this morning, after you'd left? She thought about how to answer that. She thought about Taft's voice on the phone and the frame on Solis's tablet and the orange doorstop under the supply access door. Because the job wasn't finished, she said. He looked at her for a moment. Then he looked at the window, at the same flat white Denton sky she'd been watching all day. There's a woman in Vancouver, he said, a federal witness from another case. They said Pratt was involved in her situation. I know. Is she? I don't have that information, Maya said. It was true. She'd asked Dalton at 3:15, and he'd said it was outside his jurisdiction. She'd noted the specific quality of that answer. Outside his jurisdiction was not the same as she's fine, and filed it in the part of her mind that would worry about it later, on her own time. Hollis nodded. He looked tired in the specific way that someone looked tired when the adrenaline that had been holding them together all day had begun to metabolize. "You should sleep," she said. "Yeah." He looked at her. Reeves. Maya. Maya. He said it the way Taft had said it, with a particular weight, the weight of someone using a name they felt they've earned the right to use. "Thank you." She looked at him. She thought about the operating room, the 214 flatline, the silence before she'd said those 3 words. She thought about 11 months and a corporate health directive, and a man who'd gone back into a company for a few documents and ended up here. "Get some rest," she said. She updated his chart, signed the handoff notes for the evening shift, and collected her bag from the staff locker room. She sat on the bench again. Same flickering fluorescent, same industrial detergent smell. She checked her phone. There was a message from Taft, not a call, a text, which was unusual for him. Federal Protective Division is opening a joint task force review of 6 Valdres-adjacent cases in 4 states. Consultation positions available. Not asking for a commitment. Asking if you'll take a meeting. She read it twice. She put the phone in her pocket and sat for another minute. Not because she needed to think about it. She'd been thinking about it since 5 a.m., even if she hadn't acknowledged that to herself. But because she was tired and she had spent 16 hours making decisions, and she was allowed 1 minute before she made another one. She stood. She got her jacket from the hook inside the locker. She picked up her bag. She was at the locker room door when her phone vibrated again. Not Taft this time. Not Dalton. The unknown number. The first one. From this morning. The one that had sent 6 words before any of this had begun to move. She stopped. She opened the text. "You should have left when you had the chance. This isn't over." She stared at it. Not a threat from someone who'd lost. The syntax was wrong for that. Threats from people who'd lost had a different architecture, a defensive anger, the grammar of someone accounting for their defeat. This had none of that. This read like someone who hadn't lost yet, someone who was not Voss, not Lau, not Pratt, not anyone currently in federal custody or in the process of lawyering up in a federal building. Someone outside the chain she'd mapped today. Someone who had been watching this entire morning from a position she hadn't identified. She looked at the timestamp on the text. It had been sent 4 minutes ago. From inside the hospital. She called Dalton before she was out of the locker room. He picked up on the second ring. She read him the text verbatim and gave him the timestamp without preamble, and she heard the quality of his silence shift in the half-second before he responded. The shift of someone recalibrating a picture they'd thought was complete. "Inside the building," he said, 4 minutes ago. "We have agents at every exit." Then whoever it is hasn't left yet. She was already moving into the corridor, jacket half on, bag over one shoulder. Or they want us to think they're still here. "I'm pulling the entry logs." A pause, keyboard sounds. "Reeves, stay in the building. Don't go to the parking structure alone." "I wasn't planning to." She went to the nursing station on the 2nd floor because it was the highest traffic point she could reach in under 90 seconds, and because being visible in a crowd was tactically different from being alone in a locker room. Tony Albright looked up when she appeared. "Is there a problem?" Tony said, reading something in Maya's face. "Not for the floor," Maya said. "Is Reyes still on too?" "He left about 20 minutes ago. There's another agent near the ICU. I don't know his name." She went toward the ICU. She was thinking about the text syntax again. You should have left when you had the chance. And the thing that snagged was the word chance. Not opportunity. Chance implied a window that had existed and closed. A window that the sender knew about specifically. She stopped walking. The only people who knew she'd been in the parking lot this morning, who knew she'd sat in her car, who knew she'd been about to leave, were people who had been watching the parking lot. Dalton's team had been in the building since 3 a.m. They'd been inside. The parking lot surveillance was external. Or someone inside the building had seen her in the lot from a window. She turned and looked at the second-floor windows that faced the main parking lot. 3 of them were in direct sight line of the space where she'd parked this morning. One was at the end of the surgical prep corridor. One was in the staff break room. One was in the office of the surgical department's administrative coordinator. She went to the administrative coordinator's office. The door was closed. She knocked. No answer. She tried the handle, unlocked, and opened it. The office was empty. Desk, computer, filing cabinet, the ordinary architecture of administrative hospital work. Window facing the parking lot. From this position, the space where she'd parked this morning was clearly visible, clearly lit by the lot's overhead lights in the pre-dawn dark. She looked at the desk. The computer screen was in sleep mode, but the indicator light was active, recently used. She looked at the desk's surface. Coffee ring, a pen, a notepad with something written on it, and then crossed out, a staff directory that had been left open. She photographed the notepad with her phone, even though the crossed-out writing was mostly illegible, because evidence was evidence regardless of whether she could read it. She looked at the staff directory. It was open to a page she couldn't immediately make sense of, until she looked at the tab. Internal Medicine Department. She called Dalton again. Who is the administrative coordinator for the surgical department? Hold on. 30 seconds. A woman named Sandra Orr, been at Harlow General for 7 years. Where is she right now? She signed out at 4:50 this morning. A pause. Reeves. She signed in at 2:40 a.m. 2:40 a.m. An hour before Dalton's team arrived. An hour after Garrett Hollis had come through the trauma bay doors. She's the one who flagged the Praxis trial, Maya said, working through it as she said it. Not Wolf first. Wolf came later. There was someone inside the hospital who knew about the trial because she processed the administrative paperwork for Voss's research partnership. She saw the numbers. She knew what the falsified data looked like because she typed the real data first. She stopped. And when Hollis arrived last night, she called someone. She called the number associated with Doyle Pratt's secondary contact, Dalton said. His voice was very flat. We just pulled her phone records, 12 calls over the past 14 months. The first one was 3 weeks after Praxis Biomedical was acquired by Valdris Group. She's not a Valdris asset, Maya said. She's someone who is protecting Voss. She knew him. 7 years in his department. Or protecting herself, Dalton said. If she typed the falsified data, even if she was directed to, even if she didn't understand what it meant at the time, she has exposure. That was the architecture. Not corporate loyalty. Fear. The most ordinary and most devastating motivator. She sent the text from inside the building, Maya said. She signed out at 4:50. She could have signed out and stayed. Can you pull the lot cameras? Her vehicle? Already running. A 30-second gap. Her car is still in the employee lot, east section. She's still here, Maya said. Yes. A pause. And Reyes is covering the east exit. Gus. They found Sandra Orr in the east stairwell on the ground floor, sitting on the bottom step with her coat on, and her bag in her lap, and her phone in her hands. And she looked up when Dalton and Reyes came through the door above her, and Maya came through the door below her, and her face had the quality of someone who had been sitting in a stairwell for 40 minutes trying to decide what to do next, and had not managed to decide. She was 61 years old, she had short gray hair and reading glasses pushed up on her forehead, and the look of a woman who had spent 7 years being very good at an invisible job in a department where invisible jobs were how the visible work got done. She looked at Maya. I didn't know about the compound, she said. Her voice was steady, in the way that voices were steady when the person had been sitting alone for long enough to arrive at a kind of exhausted calm. I didn't know what Pratt was going to do. I called him because... She stopped. When Hollis came in last night, I panicked. I thought if they pulled the trial records, they'd find my signature on the data transfers. She looked at her hands. I just wanted him to be moved to another facility. I didn't know they were going to... Ms. Orr, Dalton said, and his voice was not unkind. I need you to stop talking without an attorney present. She closed her mouth. She looked at Maya again with the particular quality of someone looking at the person they'd tried to threaten and finding that it hadn't made them feel any better. I'm sorry, she said. Maya looked at her. She thought about the text. You should have left when you had the chance. And the person who'd sent it, sitting in this stairwell, in her coat, with her bag, not quite able to make herself walk out to her car and drive away from what she'd spent the morning trying to protect. "I know," Maya said. She meant it, which was complicated. Complicated was the accurate word. Sandra Orr had made a series of choices that had put Garrett Hollis in danger, and the fact that those choices came from fear rather than malice didn't make them less consequential. But Maya had spent enough time in enough institutions to understand that the people who did the damage from the middle, the people who typed the numbers they were told to type and signed the transfers they were told to sign and then spent 7 years hoping nobody looked too closely, were not the architects. They were the material the architects built with. That didn't mean no accountability. It meant the accountability had a shape that was different from Voss's or Pratt's or Kendra Lau's. She stepped aside to let Reyes through, and she went back up the stairs. The federal processing of the evening took 4 more hours, and Maya spent most of it giving a formal recorded statement in a conference room on the administrative floor. She was thorough, she was precise. She answered every question completely and without editorializing, because she had learned a long time ago that the statement was the document that outlasted everything else, and it needed to be accurate. At 9:15, Solis brought her coffee that was better than the hospital cafeteria coffee, which was a low bar but represented genuine consideration. Valdris Group's legal team withdrew their remaining motions at 7 p.m., Solis said, sitting across the conference room table from her. Their lead attorney issued a statement about cooperating with the investigation. She said it with the particular dry tone of someone who had spent a career watching powerful organizations discover cooperation the moment the exits closed. 3 executive-level employees of Valdris Group have been contacted for interview. 2 have already retained counsel. Praxis Biomedical, Maya said. The trial data is being re-examined by a joint medical review board. All former trial participants are being contacted. Solis paused. There are 47 of them. Of that number, 9 experienced adverse events. The clinical review will determine how many of those events were related to the falsified data. 9 people. Maya held that number. She thought about Roy Ferber's wife in a long-term care facility. She thought about Petra Hollis and a school friend. She thought about Nadia Wolf in protective custody in another state, who had walked out of Harlow General 18 months ago with documentation and a decision and had not been wrong about what it would cost her to make it. The Vancouver case, she said. Solis looked at her carefully. That's outside this jurisdiction. I know, Dalton said the same thing. She held Solis's gaze. Is she alive? A pause that lasted exactly long enough to be deliberate. Yes, Solis said. She is. Maya let out a breath she hadn't fully acknowledged she was holding. She's been moved to a different location, Solis said. The connection to Pratt establishes that her situation was more precarious than the protecting agency had assessed. That's being addressed. She picked up her own coffee. I'm telling you more than I should. I know, Maya said. Thank you. That's it. The hospital at 9:40 at night had a different quality than the hospital at any other hour. The day's urgencies had either resolved or settled into the sustained management of critical care. The corridors had the specific quiet of institutions that never fully sleep. Not silent, but lower, like a volume dial turned to a sustainable level. Maya was walking toward the main exit when Linfield appeared from the direction of the surgical floor. He looked like a man who had been in the building for 20 hours and had stopped noticing. Hest wants to know if you've decided, he said. I told him I'd think about it. It's been 7 hours. It's been a long 7 hours. He walked beside her toward the exit. Not because they were going in the same direction, she suspected he'd turned around from wherever he was actually going to walk her out, which was the kind of thing she chose not to comment on. The surgical department is going to be in a difficult position for a while, he said. Voss built a lot of the infrastructure around his own authority. Some of that infrastructure was good. Some of it was the kind that looks like process but is actually just one person's personality calcified into policy. I know the type, she said. Hast is serious about the structural review. He paused. He's also serious about you. Not just as a skilled clinician, as someone who can look at the way this department runs and tell him what's actually wrong with it. He glanced at her. You've been here 4 months as an outsider. You see things that people on permanent staff stopped seeing years ago. She thought about the 4 months. The way she'd learned to navigate around Voss's moods, around the social architecture of a department that had organized itself around a single dominant personality. The way the agency staff spoke to each other in the supply corridors. Low, careful, always one ear on whether anyone important was nearby. The junior residents who deferred even when they saw something wrong because the cost of not deferring was too high. There are 3 agency nurses on the surgical floor who are better clinicians than half the permanent staff, she said. They'll never be told that. They'll cycle through this building for years on contract, and nobody will offer them what Hast offered me today, because nobody is looking at them. Linfield was quiet for a moment. Say that to Hast, he said. In those words. I intend to. They reached the main entrance. The automatic doors opened to the night air, cooler now. The parking lot lit in the flat orange of overhead lights. Her car was where she'd left it, still in the same space, which felt like it belonged to a different version of the day. She stopped at the entrance. Warren, she said. She'd never used his first name before. He registered it without making it a thing. Yeah. In OR2 last night, she said, when you told Voss to let me work. I know what that cost you. He was quiet for a moment. It didn't cost me anything I wasn't willing to spend, he said. The patient was going to die. Other people in that room made a different calculation. Other people in that room were wrong. He said it simply, without ceremony. I've been wrong before. I try not to make the same mistake twice. He looked at the parking lot. Get some sleep, Maya. She went to her car. She slept for 9 hours, which was not something she'd done in years. Not 9 consecutive hours. Not without the half-wakefulness that usually sat underneath sleep, like a layer that never fully switched off. She woke to a morning that was gray and clear, the particular clarity of Pacific Northwest autumn that had nothing soft in it, and she lay still for a few minutes, doing the accounting that her mind did automatically every morning. What had happened, what was still unresolved, what needed to happen next. The unresolved list was shorter than it had been 24 hours ago. Not empty. It would not be empty for a while, but shorter. She called Orrin Taft at 8:30. He picked up on the first ring, which meant he'd been waiting for her call, which meant Dalton had told him to expect it, which meant the whole thing had been orchestrated with the patience of people who had learned that pushing Maya Reeves toward a decision made her move in the opposite direction. She found she didn't mind. I'll take the meeting, she said. A pause. The particular quality of Taft's silence when he was satisfied but was not going to perform satisfaction. When? He said. After I finish a conversation with the CMO of Harlow General. Another pause. You're going to try to do both. I'm going to find out if both is possible, she said. Clinical work here. Consultation on the task force when the cases require it. She looked out her apartment window at the gray morning. I'm not going back to the field full-time, Orrin. I need you to understand that. I understand it, he said. I mean it this time. You meant it last time, too, he said. Circumstances change what's meant. These circumstances are different. He was quiet for a moment. Because of the patient. She thought about Hollis signing the refusal form with a weak hand. She thought about the direction his eyes had settled when he'd first come up from sedation, approximately, imprecisely, toward her face. She thought about the 9 people in a clinical trial whose adverse events were now under review. Because of all of them, she said. What? The meeting with Hast happened at 10 a.m. in his office, which was larger than the conference room, and had a window that faced the hospital's internal courtyard, a space with 2 benches and a tree that was turning yellow at the edges in the early autumn. She sat across from him and said what she'd told Linfield she intended to say, in those words, about the agency nurses on the surgical floor. She said it first, before anything about her own terms, because the order of it mattered. Hast listened. He didn't perform listening. He actually did it, which she could tell because his first response was a question about the specific nurses rather than a statement about policy. They talked for 40 minutes. What she accepted was not what he'd originally offered. It was something negotiated, a permanent clinical position on the surgical floor, yes, but also a formal role in a staff equity review that Hast agreed to commission, an actual structural examination of how contract staff were evaluated, compensated, and considered for advancement. She would sit on the review committee. She would have genuine input, not the kind that produced a report that lived in a filing cabinet. In exchange, she would work within the institution's systems rather than around them, which she understood to mean that the next time she observed a clinical error in an operating room, she was expected to speak through established channels first. She'd told him she would do that where established channels were adequate. And where they're not, he'd said, then I'll do what I did in OR2, she said, and I'll document why the established channel was insufficient. He had looked at her for a moment. Fair, he said. She signed a direct hire agreement at 11:15. Her hand was steady. Garrett Hollis was transferred to a standard surgical recovery room on the third day, which was a meaningful transition, out of the ICU, off the intensive monitoring, into the quieter work of healing. His pressure had normalized. His rhythm had stabilized. He was breathing room air with a saturation of 97%, which was the number of a person whose lungs had decided to keep working. Maya stopped in on the afternoon of the third day, not as his assigned nurse. She'd been careful to keep the professional boundary appropriate, but as the person who had been his nurse for the most significant 24 hours of his hospitalization, which she thought entitled her to a brief informal check-in. He was sitting up in bed, talking on the phone. He wrapped the call when she appeared in the doorway and looked at her with an expression that had more rest in it than the last time she'd seen his face. "Your numbers are good," she said. "I know, Dr. Linfield told me this morning." He set the phone on the blanket. "Petra is coming tomorrow." "That's good. She's been in contact with the investigators about the trial review." He paused. "She says the medical board is already moving on 3 of the 9 adverse event cases. The families are being contacted." She nodded. "It's not enough," he said. Not bitterly, just accurately. "No," she agreed. "It's not. But it's something that wasn't happening before." He looked at the window. The courtyard tree was visible from this room too. Different angle, same yellow at the edges. "Wolf," he said, "have you heard anything?" "She's safe," Maya said. "She's been moved. That's all I know." He accepted that. He had the particular acceptance of someone who had learned that partial information was usually all you got and had stopped resenting it. "There's going to be a federal press briefing next week," he said, "about the investigation, about Valdris Group." He looked at her. "Your name is going to come up." "I know." "How do you feel about that?" She thought about the 4 months of being the woman nobody noticed. She thought about the supply corridor and the terrible coffee and the way the permanent staff talked around her in the nursing station. She thought about the OR at 2:14 in the morning and the silence before she'd moved. "It's not about me," she said. "It never was." He looked at her steadily. "It was a little bit about you," he said. "You were there. You made choices that required something. Let yourself have that." She was quiet for a moment. "Get some rest," she said. He almost smiled. "You say that a lot." "People need to hear it a lot." She went back to her floor. Mom. The press briefing happened 8 days after the events at Harlow General. It was covered regionally and then nationally, in the particular way that stories about pharmaceutical fraud and falsified clinical trials traveled, with a specific combination of outrage and recognition that said this is a story people had been waiting to see confirmed. The Valdris Group's stock dropped 31% in 2 trading days. Their board issued a statement about cooperating fully with investigators, which was the statement boards always issued when fully cooperating was no longer optional. 3 Valdris Group executives were indicted within the month. The charges were substantial: securities fraud, obstruction of justice, conspiracy, and the falsification of clinical trial data. The indictments named the Praxis Biomedical acquisition and the trial results specifically, with a footnote referencing the deaths and adverse events that had been obscured by the falsified data. It was a long footnote. Harlan Voss was charged separately in a state proceeding with criminal conspiracy and tampering with medical evidence. He surrendered his medical license pending the outcome. The surrender was not voluntary. It was the result of an emergency board action that happened within 72 hours of his arrest, which was the kind of institutional speed that only manifested when an institution had no alternative. He was released on bail and gave a statement through his attorney about cooperating and about the pressures he'd been under and about circumstances. The statement had the grammar of a man who had spent his life being the authority in every room and was discovering, in a new and unwelcome way, that authority was not the same as being right. Kendra Lau and Doyle Pratt were held without bail on federal charges. Pratt's cooperation, which began approximately 4 hours after his attorney arrived and reviewed the evidence against him, produced the communication chain that connected the Vancouver case to the Valdres Group's internal security division. It was the connection that elevated the indictments from financial fraud to something more significant. Sandra Orr cooperated fully from the first formal interview. Her attorney negotiated a reduced charge in exchange for complete documentary evidence of the data transfers she'd processed, including the original unaltered trial data that she had, it turned out, preserved in a personal encrypted archive for 4 years. Not because she'd planned to come forward, because she couldn't make herself delete it. That archive became a central piece of evidence in the medical board review of the 9 adverse event cases. The review found that 6 of the 9 adverse events were directly attributable to the falsified dosing data in the trial results. 6 people. It was a number that the regional coverage mentioned once in the 3rd paragraph, and that Maya read 3 times and did not put down for a long time. Gimam. The Staff Equity Review Committee held its first meeting on a Tuesday in October, in a conference room on the administrative floor, with 7 people around the table including Maya, 2 other clinical staff representatives, a human resources lead, a legal representative, and William Hast, who sat at one end and did not speak for the first 40 minutes. The meeting was not smooth. It had the particular productive friction of a group of people who were supposed to be looking at the same problem, but were looking at it from positions that didn't entirely overlap. The HR lead had language about existing policy frameworks. Maya had 4 months of walking through a surgical department as someone those frameworks did not protect. At the 40-minute mark, Hast spoke. "What is the single most important change," he said, "that would have altered the outcome of what happened in OR2 3 weeks ago?" The room was quiet. A culture where the most junior person in the room felt able to speak without calculating what it would cost them, Maya said. Hast looked at her. "Then that's where we start." It was not a simple thing. It was not a thing that a committee meeting resolved or a policy document fixed. She knew that. The other clinical staff representatives knew it. The HR lead knew it too, she thought. She could see it in the way the woman wrote notes with more energy than she'd had for the policy discussion. Some things changed because of rules. Some things changed because enough people decided, in enough individual moments, to do something differently than they had before. She'd spent 4 years believing she could live entirely in the second category, outside institutions, outside systems, invisible and accountable only to herself. One night in an operating room had reminded her that the second category didn't work without the first, that showing up was not the same as being counted, that the moment she'd walked back through those automatic doors at 5 in the morning, she'd chosen both. She didn't regret it. She was still working out what it meant. In November, she received a card. It was addressed to the hospital, to her name, in handwriting that was not fully steady. The handwriting of someone whose right hand was still building strength back. Inside, no message, just a signature. Garrett Hollis. And below the signature, in different handwriting, rounder, more practiced, clearly a different person. A single line. "Thank you from both of us. Petra." She kept the card in her locker, not on display, not on the desk where she did her documentation, in her locker where she would see it when she arrived and when she left, and at no other time. Some things were private. Some things were just yours. There was a morning in late November when she arrived early, before the floor fully woke up, and stood at the window at the end of the surgical corridor that faced the parking lot. The lot was still half dark, the overhead lights competing with an early sky that hadn't decided what color it was going to be yet. She thought about standing in that lot 8 weeks ago. The phone in her pocket, the car she didn't start, the 6 words that changed the shape of a decision she'd already been making. She thought about what it meant to be the person nobody noticed. She'd worn that for 4 months like a strategy, like protection. She'd told herself it was practical. It had been for a while, and then it had become something else. The habit of smallness, the practiced diminishment of someone who had learned that visibility cost too much. What she knew now, standing at this window, was that the cost didn't disappear when you made yourself invisible. It just transferred. It transferred to the person on the table who needed someone to speak. It transferred to the junior staff in the supply corridor who learned from watching what happened to the people who did. It transferred outward in ways that invisibility told you weren't your problem. She wasn't going to say it was simple. It wasn't. Speaking had cost her in that room and in the hours after, and the cost had been real. But the alternative, stepping back, removing her gloves, walking out, was also a cost. It was just a cost you paid later, in a different currency, in the private economy of what you knew you'd done and hadn't done. She'd made her choice at 2:14 in the morning in an operating room. She'd made it again in a parking lot at 5 a.m. She'd keep making it, imperfectly, sometimes badly, never with the clean edges that stories like to give to decisions, for as long as she worked in this building. The sky outside the window had arrived at its color, pale gray gold, the particular early light of a morning that was going to be cold and clear. She turned away from the window and went to start her shift. The floor was waking up around her, monitors, voices, the morning machinery of a place that existed to hold people through their worst hours and return them, when possible, to their ordinary lives. She walked through it like she belonged there. Because she did. Not because they'd finally recognized it. Not because a CMO had offered her a contract or a federal agent had said the word exceptional in a hallway. She belonged there because she'd decided she did, years ago, in the specific way that quiet people decided things. Without announcement, without ceremony, with nothing but the full weight of themselves behind it. The woman they hadn't seen was still here. She had always been here, and she was just getting started,